One side. Eight to the other side. That's good.
8 to the bar.
That's right. That's right.
Oh, somebody's here. Is this thing? Are you working?
Hi, come on in.
I'm sorry, it was the traffic.
You had traffic?
It took me like half an hour from Trump building to
From where?
from Trump building
I
to
have
here.
a symptom sheet.
Oh, on the bus? Yeah. Yeah, and the bus on Lakeshore Drive was real slow too. Traffic was just stopped.
Okay, thanks.
It looks different. It is.
Looks
Right,
like
right,
sorry.
right.
It's okay. It's okay. Oh, this is on top of it.
I'm on time.
Right on.
Okay, so good.
I'm not late. You said
Okay, put your
6:30.
name. Yeah, 6 o'clock. Yeah. Go ahead. Write your name. Okay? Just your first name. Let's put today's date. So, tell me where it's been hurting. You said you've been hurting in the
Yeah, exactly.
You went through it.
This.
Just like that. Okay.
Oh, this place I had that pain from many years.
Oh, many? How many?
5 maybe from the time I was working.
Mm-hmm.
My work gave me that pain.
Right there.
Freshie gave me
Right there.
the pain here.
Oh, let me see. Or the freshie pain. Let's hear the freshie pain.
Oh, you work at Freshie
That's
downstairs?
it, yeah.
No, that's because I stand for 8-9 hours straight.
Yeah. So that's from
Oh.
standing. You get it right here.
Yep.
From standing. Okay. And this is from sitting.
That's like always whatever I'm doing.
Sitting and computer. Okay. And how much pain is that? You ready, Justin?
About ready to start.
Okay. So how painful is this one here, the freshie one?
Oh, the freshie one is bearable.
Well, how
It's okay. I fell
Oh, it's not
asleep
so bad.
and I
Okay.
can wake
Well, how
up.
much this one? What's the pain
That's
level of that one?
unbearable. It wakes me up from sleep.
Ah, waking you up, wakes you up. Ready?
So heavy.
So it wakes you up.
So yeah,
How about
that
right now?
depends.
Where does it hurt right now?
Sorry?
Where does it hurt right this minute? Right now, during the
Yeah.
day, not at night. Yeah. So, but at night, it's always.
Oh, it's always the same place.
Constant.
Yeah.
Constant.
It just varies in the intensity.
Ah, constant. It varies.
Hello, everybody. All right.
Got my camera.
This class is going to be very, very exciting. It's very important to know these. These are the underlying perpetuating factors that cause pain to start in the first place. Everybody knows we've got modern lifestyle with a lot of sitting and not much activity. So there are plenty of perpetuating factors that coincide with our modern lifestyle, and some of those we could probably do better on. And most everybody recognizes them. You know, better posture, sitting in your car in a slouch position or something like that for too long of a period, you know, hunched over a computer or a laptop or something. But that's not the type of perpetuating factor we're going to be talking about today. We're going to be talking about those that there's pretty much no other field besides this one that addresses them. These are perpetuating factors that will make you look somewhat like a miracle worker when you do something simple like put a lift under one ischium and balance someone's pelvis, and all of a sudden pain that they've had 3 surgeries to try and get rid of goes away. This is the kind of stuff that really changes people's lives and makes you look really good in your practice, and helps people maintain the corrections that you're working so hard to achieve every visit with them. So these are the underlying perpetuating factors. This is the big deal stuff. And I was going to start by showing a little bit of what what I like to do in terms of organization. So let's take a look at a few things that we've got here on the table.
So I'd like to say hi to everybody. Hi, everybody. And where are you coming in from? Anybody from Florida? Anybody from Naples? Anybody from Hawaii? Indiana?
Orlando.
Orlando? Okay, good. Orlando, great. Orlando, Florida.
Tip City, Ohio.
Good. Ohio, wonderful. So, how important is it to help people with the underlying perpetuating factors? What do you think? It's pretty important.
10 out of 10.
So, Dr. Travell and Simons was really, they thought the underlying perpetuating factors were really important. And guess what I found out? They're really important.
Lancaster, California. Thank you.
Right.
Oh, California, what part?
Lancaster?
Lancaster. Great. Welcome. So we're going to work on underlying perpetuating factors today on the upper body, then next week on the lower body, and then the following week we're going to focus the whole class on Morton's foot, and so first metatarsal deficit. So that's coming up the following week, and then we're going to do pelvic floor pain after that. So that's our next 4 weeks there, three or 4 weeks today and the next few. Okay, so underlying perpetuating factors. So it's great to have somebody that you can test. So today we've got somebody here to test.
Hey.
Hi.
This is Tony, and we're gonna test him and take a look at. So we're gonna ask the question: if we correct some of the underlying perpetuating factors, will his pain go away? It possibly could. You know,
Maybe without even touching a muscle, you mean?
it's possible. It's possible. It's possible. So we'll just see. And Camille's here again,
Hi.
and we have Stephanie. She's
Stephanie's
here
here
too. She's
too.
looking at first metatarsal lips over there. And myself, Sharon,
Yeah.
and Justin. So
Yeah.
we're going to take a look. Let's take a look at some things we got here to look at for underlying perpetuating factors.
Yeah. I wanted to give you guys a look at this. We have these tracking sheets. It's like treatment in a glance. And wanted to show you that, so that in a one quick glance, you should be able to see exactly what's going on with the patient at all times. So this, here's the patient name. This is the date they came in, the therapist that performed that evaluation. Their goals are here. What's that? ROM to pass? Range of motion test you'd like to pass. Okay. Any cautionaries? This is their plan, like they might be on a once a week or twice a week plan, and when you would like to evaluate them next. This right here is called a compliance calendar. And it means that if you wanted them to come in twice a week for 6 weeks, then, here's week 1. You put an X on the days they came in. If it was Tuesday and Friday, they made that. And then week 2, Monday and Wednesday, it would be 4 X's. And, you can see this. And then let's see, then Monday and Wednesday. And then, but let's see if this next week there was none. This next week there was none. This next week there was just 1. And the next week none. And next week they came in like this. And they were saying, I'm not feeling like I'm getting anywhere. Well, you could say, well, look, you only really followed the plan for 2 weeks here. And then, this is a good compliance calendar. And it gives you at a glance how many times they've been in. You can just count the X's real quick. Oh, that's 7 visits in the last 8 weeks. Okay, all right, cool. Well, and the neat little thing is then over here, we have, you can either put like the pain key that you're working on. Let's say it was last week we did pain key 18. Right, and then the main muscles we might have been really important would be the psoas, and let's see, maybe the glutes, and then maybe those are the 2 main muscles. And then each date they come in, you just put down, visit 1, visit 2, and the date. So today is 31st, right? So, I was trying to write while holding the camera through the lens. Funny. All right. Anyway, rate their pain level per day. Every time they come in, we have them fill out a symptom sheet, right? Let's see Tony's symptom sheet. No, it's okay. Where's Tony's symptom sheet? Here. Is this Tony's symptom sheet? Sharon, do you know where Tony's symptom sheet?
I was just turning up the phone. This
Yeah,
is Rain.
that's it.
Okay, so
This is Tony's symptom sheet?
yes, it is. There's his name. There he is. That's Tony's symptom. So look at the pain he's got. This is here from sitting and from using the computer. And this is from standing, so when he stands a lot, sometimes gets this, but this is what really bothers him. And so tell us on a scale of 1 to 10, if 10 is excruciating, how painful is this one? So take a look here. So how painful is this area right here?
Oh, I used to be like this before.
Yeah.
After I started working slowly,
Yeah.
it came down to like this.
Oh, I
because
see. You
of
can
the
see
heavy pain.
Oh, the pain,
I
yeah.
don't stand straight for long because it
Uh-huh.
hurts.
How much
it's
does it hurt?
Excruciating sometimes.
Excruciating. Oh,
Sometimes, if
excruciating.
I'm like extremely straight,
Yeah.
if I stand like straight for a long time, I get that. So,
So this
slowly
way,
stoop on.
slowly you come this way. Yeah,
I came
yeah.
that way after 2.5 years of working and sitting in front of the computer.
See? And how many of us are doing that?
Oh yeah, that's a lot.
Longer than 2 years.
A lot of
for
us
sure.
are doing that.
So you would
right?
say that's 8 out of 10, 9 out of 10, on a
Anyways,
scale of 1 to 10.
excruciating, 10.
10 out of
That's
10.
10 out of
Okay.
10.
Or
So then he could
That's-
put,
Yeah, yeah.
you know, you could put that today's pain level is a 10, right? Okay, and then here you could just put the, you know, amount of self-care and amount of manual therapy you did, and that's it. But the neat thing about this chart is, so all in a glance, at the bottom we have all the perpetuating factors, and so you know whether you've evaluated them or not in the past, because you would have a check mark, you know, by the ones you've done. So today we're going to be looking at upper body ones. So we're probably going to do a little bit of postures. You might look at that. Sleep might be something. Short upper arms is an upper body perpetuating factor. Breathing is an upper body perpetuating factor. And so those are things that you'll want to, what we usually say to the patient is, if we're going to do a thorough evaluation of you, we want to make sure that before your care plan is up, we get through all these perpetuating factors to make sure that there isn't something causing your pain to come back. Because no matter how good of a job we do here, if we don't cover, if we miss an underlying perpetuating factor, the likelihood of your pain coming back is really high. So that's just a way we like to keep track of people, and at a glance we can see everything that's been done. And so today we're looking at upper body perpetuating factors, and you know, but ideally you'll want to go over all of the perpetuating factors with everyone. So for the next 3 weeks, we are making you a master in a field that hardly anyone is taking care of, which will make you, you know, incredibly valuable to your community in terms of helping them stay pain-free.
Okay, well, so we can take a look at a lot of underlying perpetuating factors, but we're going to particularly look at Tony and what's going on with him
Great.
as a model to look at a lot of the things that we'd like to look at on everybody.
Yes.
So, and we'd like to see if maybe some of the underlying perpetuating factors, if we correct them, might take away some of his pain. So today, right now, how painful is this area right here?
7.
7 right now.
Yeah.
Okay, so 7 right now, so that we'll go with that for right this second.
Sounds
And so,
good.
and so we're going to take a look at all different kinds of things. But see, here's a couple of things that cause the pain there. Okay, so a paradoxical breathing causes it. That's one of the. So we're going to take a look at that. We're going to look at short upper arms, see if that might be a problem. We're going to look at your feet and your legs to see if they're even. We're also going to look at this pelvis and see if your pelvis is even when you're seated, and if it isn't, that could be a problem. So we're going to look at poor posture on sleeping, sitting, standing, head forward, like you already showed us. You've got a problem with. Okay, all positions, straining and looking at the computer screen. We already discussed that. Look down at the keyboard. Bird watching.
Bird watching. Well, back when the myofascial books were written, bird watching was a lot more popular than it is now, probably.
Bird watching. Kyphosis, coming like this way, like that. Okay. Leveling uneven shoulders and or hips, you know, so leveling all of them will be important. Scoliosis, short pecs here, short abdominals, pulling you forward like that. Shortening of all the muscles in the upper body, it could be underlying perpetuating factor. And sleep position could cause neck pain. Sleep position could cause shoulder pain, really bad shoulder pain. You know, it's just laying on that shoulder. What if you laid on that shoulder for 50 years? It could get a little tired of that.
Absolutely. Yeah.
Cause rotator cuff and also super sensitive spinal segments in the cervical and thoracic area.
Yeah.
Could all be underlying perpetuating factors. So we're going to look at quite a few of those this week, next week, and the following week. Okay. Okay, so let's take a look and see what we notice in you. Okay, so see if we notice any important underlying perpetuating factors.
Yeah,
So
after these classes are over, we'll make all the forms that we use available for download in the same place that you get the protocols. I'll put them online, okay?
So let's take a look. So you notice how he likes to turn his feet out.
Mhm.
So that's usually one of the telltale signs of first metatarsal deficit, which causes you to have your head like this,
Yep.
standing. Okay.
Did you
So-
guys see that? So his
So here,
toes.
so let's put your feet the way they were a second ago. So yeah, a little bit more. Your head a little no, more like this, You know, like.
Yeah, just doing.
Oh yeah, he's doing the cool guy stance.
No,
That's a cool guy.
I do like pressure on one leg more.
Yeah.
Then I shift to the other leg.
Yeah, that's this syndrome that causes the neck. So this is what we're going to look at, okay? So we're thinking, what if we correct that? Will it make the neck better? We're wondering. We're going to wonder together, okay? We're going to wonder together to see if that makes a difference. So also we're going to check paradoxical breathing and stuff like that. So let's start with the feet and the shoulders and stuff. Let's look at your height of your shoulders and look at that. So let's stand there and just look straight ahead of you. So you can see here, if you look at his shoulders, you can see one shoulder is higher than the other. And if I had a something like this, we can see that it's like here.
We could hang a picture frame on his back.
So it's pretty uneven like that. Okay, so that could cause you to have a lot of upper body pain and dysfunction. Okay, so we put that over there.
This falls
this is-
under that category of posture.
Mhm,
So posture or asymmetry.
Asymmetry, yeah. So so here I'm gonna put. So here we go. This one's up and this one's down like that. So he's like that. Let's go ahead and let's look at the hips. And here you can see this hip is higher than the other. So right like that.
Left hip high.
Yep. So we go like this. So you can see that. Then we're gonna also take a look at the anterior posterior, and you can see that he's forward here on the right. Now I'm going to look on the other side. So I'm
shows
going
it.
from the and then this side it's not. Yeah. So here I'm going from the posterior superior iliac spine from the anterior. You can see we have a good so the two sides aren't the same. So here.
So the ilium is rotated forward on the
And
right.
then it's pretty even, like this on the other side. So on the left, on the right, it's anterior tilted, and on the left it's normal. So let's see if we can correct some of those things. Let's take a look also at the seated posture and also at the head posture. So let's just look at you from the side. Okay, so here, so the ears are a little forward. So if you could, so here you're looking. Can you see if so here I can see the head's a little bit forward.
A little bit anterior head carriage there.
A little bit. So make a little note of that. Yes.
And we'll get you guys this form. This is like all the perpetuating factors evaluation.
So here for this, I'm going to check for sharper arms. So for this, you find the top of the ilium. You feel the top of the ilium, and then you see if the elbow comes to the ilium. Then also you see on both sides. So if you can see so yes, it comes to the top of the ilium here, and it does here as well.
Yeah.
So he doesn't have short upper arms.
So you can
No.
no short upper arms.
No short upper arms.
And the way we record that over here, guys, is we see
Go ahead,
short
put it
upper
right there.
arms. We put that. We evaluated that on
Okay, good.
5/31,
So we got
and the
that.
result
So let's
was
just sit down for a second.
uh,
And you're the-
negative. There's no short upper arms. Okay. But posture, we evaluated also this on 5/31.
Yeah, yeah,
Okay.
you do that.
Short arms. Swipes. Okay. 5/31, and the result is, I would say, C form because there are quite a few postural things there.
Okay, in the seated posture here, you see that the left is lower and the right is higher. So this could be causing everything on the right side here to be heightened tone and could cause pain between the shoulder blades and could cause the scalenes to be, also the standing posture could do that too. So here you can see, this one's higher, that's lower. Now if we put this here again, you'd see he's kind of like at that angle, like that. So he's not even.
So then
So-
she'd come and she would draw that right here.
That's right.
And does anybody know, can you guys think of what does it mean that the posture was off up here and it was also seated? See, seated takes away, what factors does seated take away that standing doesn't take away? There's two factors mainly, right? Seated takes away Morton's foot's contribution, right? And seated also takes away leg length inequality. Okay, so but he sat down, he still got it. So what we might think is a
He might have a small side.
He might have a small pelvis on one side, a hemipelvis on one side.
So let's take a look and see if we can correct it. So if it's coming down here, let's take a look at the hips here and see what's going on here. So here you can see that just like it was when he was standing.
Yep.
So likely we would put the lift under this side to even them out.
Does that make sense, guys?
So we're going to put
if it's a little lower on one side,
let's lift up there, and we're going to put like a little lift under this side.
you need a very hard, firm surface like this piano bench, like a good piano bench or something like that. Good hard
That
shape.
evens it out pretty good, and that makes his shoulders even.
Okay, guys, did you see
So-
that?
So that evened him out here. So so we could just look at your spine just a little bit, okay? Okay, so here looks pretty even. Let's pull it out and see what it looks like.
We're looking for any curvatures in the spine
Yeah.
that would result from his.
So it's a little bit
You see,
curved
there's
right
a
there.
little bit of a curve there when the wedge
So-
is missing.
Tony, if it's a good correction for you, it evens out your shoulders like this, and that might take away some of the pain here, but also it would even out the hips here as well. So that's really good, and often it helps to change the position of the head. But we'll just see about that. Okay, so now let's go ahead and put it under the other side. This is like in math how you do the proof. You know,
Yeah.
when you prove in math. So here now, see what happens. So it's still pretty uneven. And how's that feel when you put it under this side? Tony?
Nothing, I feel cross.
It doesn't feel as good. So usually you pull out right away. So they don't like it usually. So that's a part of it. They have to like it. So it has to be like, oh, it feels good. Okay. So to make it a good correction. Okay.
And what
So
size is this
this
one?
here is a half inch.
Half
12
inch.
millimeters. So.
You always wear a half-inch wallet here.
Yeah,
so
yeah.
Oh,
Yeah. Oh, that's
so that corrects it.
Okay, so it's a wallet correction he usually puts in. Or maybe the wallet is the precipitating factor created this. Anyway, right now it also is it's also gets corrected by putting on me. Okay, so let's try standing and see what happens when we stand, okay? So I'm going to make a note. Go ahead and stand.
No, half inch.
Yes, I'm going to put, usually what I do is I draw under the side that I put it in, and I put half inch or 12 millimeters. Okay, corrects seated posture, okay?
Same thing here, guys. When you come over here to
So let's take a
document
look
your
at these.
results,
So could I have you take off your shoes?
hemipelvis is right here. So we checked this. We did this on
Put
5/31,
those on. Okay, so
and the result
let's say we
was
turn this way,
12 millimeter
or you could have them off also. It doesn't matter.
right
They're wet from the right.
Yeah, you better
deficit.
take them off.
Okay, 12 millimeters. So that's it.
Okay, so we're gonna take a look at his feet and his knees and stuff. So can you roll your pants up like that?
Now, guys, we're going through the
Oh,
evaluation
my
rather
knees.
here. But
Oh.
we're gonna teach you
well,
each
oh,
of
there.
them.
Oh no, not the knees. I can't see the knees. Okay, so here you
No,
see.
both my knees are like in different accents, so you'll
Okay.
have my scars there.
Okay, put your feet straight, so the feet are straight. Yeah. Okay, bend your knees. Go ahead and bend. Okay, and come up straight, and bend. Okay, see how they like to come in. So that's a problem. Also, you see how he likes to make the hammer toes here. Oh, he can correct it.
Let's do this again.
Okay.
So
So here we're gonna take a look at maybe put just a little bit of lift underneath the big toe here. Okay, and let's put just a little bit. Put this foot a little bit further away, and put a little bit underneath that one. Okay, so let's have your ankles just fall in for a second. No. Okay, okay, just stay there. Okay, now I just want to look at bend your knees again. That's better on the knees. Okay, and so let's check your back, so you can put your pants legs down. So go ahead and stand straight.
sure, we're gonna have to explain all that.
Okay,
to them
now
first.
he's even here. So here, look at, so now his standing posture is corrected from putting the little lifts under. So so we'll see how much works for him, but I'll try 3 millimeters, I'll try 6 millimeters and see if it still corrects it. So it really would make a big difference. Plus, if you take a look at his head, probably the head is starting to come back just a hair. You know, the ears are starting to come back a couple millimeters.
All right, so let's take a look at this again. So we're just running through this very fast, but we're going to be going through this
Remember,
in
we're going to do a
detail.
whole class.
On it.
Not next week, but the following one.
Yeah.
Just on Morton's
Can you
foot.
pull up your pants again so we can
Yeah.
see the knees? Okay, so part of the test for Norton's foot, and this is
Can I have
a little bit ahead,
3 millimeters?
but
Thanks.
when the feet are about shoulder width apart, can you bend your knees now? Go lower, go lower, go lower. The knees should stay equal distant apart, okay?
That's right.
And then come back up.
They shouldn't go in and out. And they
Yeah.
should-
And then when I take these away,
All right.
can you do that also? Same exact thing?
Okay.
Okay. And go back up
So we can get our package today.
and go back down. Okay. All right, so it didn't show too much of the knees buckling in, but
Okay.
a little bit.
So,
And,
so here's a correction. Here's a shoe insert, and this has got like about 6 millimeters correction, and we're gonna try that and see if that corrects his back. So let's turn around so we can look at your back good from a distance. So we're gonna put one foot on this one, but with your big toe there, and the other one on this one with your big toe here. Okay. So right in the thick, a little higher, a little forward. Your big toe about right there, a little forward more. Yeah. Okay, get more on this thing. You have to be right on it.
Okay.
Yeah, right there. Okay, good. Okay, now, if you take a look at the shoulders at 6 millimeters there, and it makes them even. Makes them really strong, too. Okay, yes, okay. Like here. Now it's like that. Okay,
Yay.
that's even. Okay, let's look at the hips. The hips are even, too. Now this side's not so, but before, this one was down, this one was up, like that. So now it's even, yeah. So it could be that if we put these in after doing that and then treating you, maybe it wouldn't come back again. You know, so this would probably help him a lot.
What about the anterior rotation? Would that
Let's
help
look at
all?
that. Let's see if we did. Let's see if it
See if
helped.
that helped too.
We didn't look at
We
everything.
didn't look at that, yeah.
We didn't look at that. Okay, so here, yeah, that's better too. Oh, I'm tickling. Okay, so we still have a little bit of that, but let me look at compared to the other side.
The other side was straight before.
Yeah. So it's a little bit better on that. Yeah. So everything improves. So wow, how can that little bit change everything? Okay, let's take you off of it now and see the difference. Okay, we're gonna do it together. So here we're gonna do it. So step forward a foot. Go ahead and step forward a whole foot. Okay, and stand, and there it goes. See the shoulder. See how the shoulder goes down?
Do you want to
So that left shoulder
Yeah,
down?
yeah. So it went down. Now come back, and then you're gonna put your foot. The thick part of the thing is
Yeah,
right
right.
there. Yeah, you feel it. Yeah, and then here, there it goes, and it makes now it's even. Yeah. So let's go forward again. Let's step off of them again. Now this one goes up here. Now step back onto them. Now it goes down. Look at. Did you see how it did that?
Mm-hmm.
So it's correcting all kinds of things. Like it's correcting your back, your neck, your shoulders, everything. This little thing. So I just want to show it to you. So if I could just if you come off of it for a second. So look, it's all flexible, so it would be really easy to put into this nice shoe that you have here. But look at the thickness. Go ahead and see how it's thick right where the toe is. That's what's making the difference. So what I found was I had this failed surgery clinic over here in Ontario over here. And every single person that came in, they'd have all kinds of pain surgeries for pain, and they come in and I put this in, and they could take off their morphine pump. Like in other words, they did everything but correct this first. So what we should do is correct it first, and that maybe not need an operation. See.
Okay,
Okay, so this is good.
let's look at just a couple other things. Would you mind sitting up on this table here just for a second?
Let's
Let's
do
just
that.
take a look at the foot itself, so we can show people some of the other things we look for with Morton's foot.
Okay, so let's put it up in a little stool
Yeah,
here.
great.
So here, what we're looking for, let's put your foot down. So often we see a bunion, but you don't have a bunion. He's good at that. But you see that the second toe is a little longer. So that's often,
Yeah, second toe and the knuckle especially is important. So let's have you come up and bend the toes down. You see
so
how
this knuckle is more forward.
it
than
should
the
be
other
should be an
knuckle.
even line going like this. Instead, it's like a triangle like that.
Yeah.
So that knuckle, this means that this toe, this long toe, it's hard for him to get over and around that. So he'll turn his foot out, because when
Right,
you
like
step,
this, yeah.
you've got to put all of your pressure on toe off. This is the toe. When they say toe off, that's this toe. And so it's got to get around this long second toe, and
So
you
what
know,
you do is you turn the foot out
yeah, you
like
turn
this.
the foot out, rotate the
And then you
ankle
walk
in.
Then you end up walking like this
Yeah.
with your
And,
knees.
and that's why you develop.
Even when I stand, I put more pressure here.
Yeah, that's
Yeah.
it. That's it.
Because
What you-
if I'm standing for a long time, I get pain from here.
yeah, so what this
Not
does is
on
bring
the
the floor up higher to your toe.
Exactly.
Instead of your toe going down to the floor and turning your
Yep.
knee and your foot in like that,
Yep.
this brings the floor up to your toe. So this is a really good correction for you.
And for the female patients that care about, and the male patients, I shouldn't be sexist here, who care about how their feet look, that bunion development and the toes starting to hook off to the left, off to the outside, people, they don't like that. So that will help a lot and help prevent that formation. In terms of callus formation, usually with this over a long time, there'll be a little callus right underneath the second toe. Can you turn your foot out like this?
Usually, right here, you might see one. Also, you see callus usually here,
You see
right there.
a little
And
callus
often you see
formation
it
right
here.
there, right
Yeah.
underneath the hip.
Mhm.
There, and one over here.
Mhm.
So what happens is this long second toe makes their foot like a
Knife
like a knife edge, like a ice skate, and so they keep having to rotate over and over. When we put a little lift under here, lifting the floor up to meet the toe, then it's like a tripod. 1, 2, 3. These 3 points become the pressure point areas, and then his foot is much more stable. So that's a big deal. And there are so many different, Sharon could tell you that she's seen just about anything in posture result from this formation, because some people with this knife blade, they'll turn out and cause all sorts of tension up in here, and there'll be bracers on one side, and other people, their foot will fall in, and they'll be more of the collapsers, and they'll have some maybe inner knee problems. So she doesn't expect to see a particular postural problem because of this. She could see any number of postural problems. Could be different on one side than the other, but you see how his at least 2 of his postural issues cleared up right away as soon as we put a lift under there. So the
it's
body
wonderful.
compensates in all sorts of different ways
Yeah, it's
when
so
it's
great.
got to deal with this.
Yes, it's so great that we have a correction for everything for you.
Yeah.
So we could but the thing is, we do find sometimes over time we may have to change it, because it could be that when we change all your bones, muscles, and skin and fascia, that everything changes, and then maybe we won't need as much, or maybe something different might happen.
Maybe
it might-
I'll grow fat at
Yeah,
last.
we'll grow different.
Okay, thank you. You can step down now.
Yeah,
So
yeah.
same thing here. We would chart.
Okay.
Oh, thank you. So here we did Morton's foot, and remember we're going to have a whole class on this, but here's Morton's foot. We did this. Check this off. 531, and resolution was. Result was 6 millimeter. Right?
Under the great toe, corrected everything.
Yep.
6 millimeter was a good correction for him.
Yep. See, so now you're already getting a sense for who this patient is. I forgot to put Tony. What was your last name?
Tony, what's your last name?
Ready?
Ready?
R-E-D.
DY.
R-E-D-D-Y?
R-E-D. All right, so we're getting a picture for who this guy is and what he's coming in with. Although this is not exactly accurate for him, but you can see that a lot of this really, she's already gone through and eliminated quite a few things that could cause pain. That's such a value. I mean, there's nowhere else in the world that he's going to go except to someone else who's trained in this course, where they're going to have this done, and that's so invaluable. The question was, could this affect the instep of his foot? Absolutely.
Well,
Yeah.
so 2 people came in from Florida, from Naples. They might be on. They said they were going to start to watch. But they all want to learn how to treat each other, because about 5 years ago, I put the shoe inserts in both of their feet. They both had flat feet. Now they don't have fat feet anymore, and they both have arches, and they don't need any arch support at all, because their arches now are pulling up, and that's usually what happens. And also their bunion went away.
Yeah.
Both of them had bunions, so their bunions went away and their arches went up, and they can't believe it. They're so excited. They want to learn how to treat everything.
Yeah.
They're retired.
Yeah.
They have time.
They have time to do it, right?
They have time to do it now. Okay, so we'll look at some more things. Let's take a look at a few more things. So other underlying perpetuating factors could be sleep position. So so you can tell us how you sleep. Okay, so he's got it. Okay, so this is
On
so
one
this is-
side.
on one side. Okay, so
You
he
sleep
sleeps on
your
one
hands,
side.
I know.
So
On my left hand mostly.
uh-huh.
On your left hand.
Yeah.
Okay.
Sleep
On
position.
my right hand at times. I
Okay.
don't sleep facing the ceiling. Never.
Sleep on facing to the right.
Or left.
Or
to the
left,
ground.
right or left. Okay. Okay, so one of the things that can happen is you could get really bad myofascial dysfunction in the shoulders and neck from doing that. So what you wanted, so I'm going to show you how to correct that. Okay, so we'll do that. So definitely sleep position. So go ahead, let's put that down on here, Justin. You can put the sleep position one here. So he sleeps on one shoulder.
Okay.
Or the other.
And for those people who are asking, yes, Posture Dynamics is the name of the company, and you can. I don't know if I have it on their levels, but you can go to mortonsfoot.com, or you can call up Posture Dynamics out in they're out in Washington, and they are extremely helpful. Bjorn and Milady, they are the owners, and you can talk right to them. They'll get you up to snuff on all that stuff. So okay, sleep position. We put.
So I'm going to show him how to do that. We'll correct his sleep position.
Okay,
We'll take all the stuff off the table.
Great.
Yeah, do that. Yeah.
Okay, the result was he was a side sleeper. Or what was? what'd you
Yes,
say?
yes. But there's two important things with side sleeping. Is, like, when we were in the womb, we're all curled up like this, but, sometimes we have to get out.
Can't be a
So-
fetus forever.
So we're going to show you.
Get out.
We're going to show you how we could correct your sleep position. So one of the things that people do is they sit all day, but then they sit all night too, Justin. So here,
Yeah.
so this is somebody sitting
This-
all night.
More like me.
Yeah. Okay. This is like you. This is how you do it. Okay.
More.
So you turn your head to one side. Okay. So that would cause a lot of trouble. This is probably that's considered your worst position. Yeah. So we're going to show you. So we're going to show you what to do to
This.
correct it. Oh, this one or that one. Okay. I got it. So we got it there. And okay, tell us. Do you sit like this when you're at the computer too? No. Good. He's
You
gonna
wanna
show.
see how I sit?
He's going to show us. She's going to show us how he sits.
I start off like this, okay?
Yes, I see.
In another 20 minutes I will.
Then he starts with the posture problems.
Yeah.
Okay, good. Okay, so let's take a look at the sleep position, and then we'll start with then we'll do a nice one for. So now I'm going to show you a solution that we like is using the body support system, and it's sort of set up so you don't put so much pressure on your shoulder. So this.
So Sharon, you would recommend sometimes that patients get a body support system?
They have done it, and some people, if it's really important to not put pressure on your shoulder, because you've got so much pain you can't work and you really want to work, then for some people this is the right choice, But I'll show you some ways to do it without the body support system too. Okay, so here's the body support system.
And
then-
if they come in and say they're a side sleeper,
Yeah.
then you would just teach them how to do the side posture correctly?
Correct. That is correct. Or okay, good point.
Okay.
Sometimes people learn to sleep. Sometimes people learn to sleep on their back.
Okay.
So,
Or
but-
you would get them to transition.
Yeah. Now that would be okay if they're not a snorer. So if you're a snorer, then it's the other people that live with you. They don't want you to sleep on your back. Okay. So let's have you go ahead and lay sideways. So come over here and lay on your side and put your shoulder here. So come over here. So lay on your side like you're laying in your bed at home. And put your shoulder all the way here in this little crevice. And keep coming up. Yeah. And then you put this under your neck. Okay. So let your head fall like that. So now it's sort of like you have like a little pillow behind you here and a little pillow in front of you here, sort of like pushing you into one spot, So the trouble is though, look at this causes a lot of pain with the arms in this position, the way we have them. So let's have you scoot back towards me just a little bit more this way. Come this way. Keep coming. Okay, good. Okay, so what you want to do is have less bending at the hips. So you want to take a little bit but not straight. So you want them to take a little bend out, and then we want to take the bend out here and the bend out here. So all here, all these bends. So how can we do it? So one way we can do it is to put a pillow behind him here, and then the pillow sort of get it right in there, and then look it. You can put your arm like that. Look it, and he's fixing his arm the whole night instead of making it bad. He's making it better. And then this hand, you could put like a small pillow, and we don't want this one bent either, so we want to put this one kind of so it's not we're unbending it, but we're not making it straight. Okay, so what do you think? Does it feel good?
Yeah.
He could live with that.
I can sleep with this.
Okay, so this is one way to do it. But the thing is the trouble with putting your arm here is it makes everything in the front gets really tight. And also when you have your knees too close to your chest, so put your knees closer to your chest, both of them. Yeah. Now you're sitting all night. Also, you know, and then if you have the arm forward, you're sitting and shortening all your chest and muscles all night long. Okay, so this would be one way to so making sure that these legs are not so bent. So the rule of thumb is to have things not bent so much. So that we don't want the front bent here, we don't want it bent here, we don't want it bent here. We want to get the chest more open. So like that. So what do you think you could sleep?
Yeah.
Good, he could do it. Yeah.
Okay,
so
I'm not sure I'll wake up like this, but
You just start out there.
maybe we'll start out, but maybe we'll, yeah. Okay, so but it's not critical.
No,
So,
okay.
yeah. So, but you know, sometimes people put a pillow between the knees, but that would be particularly if they have tightness in this here, and if they do, then it would relieve that. So it could be important. So sometimes you could do that as well.
I do that.
Okay, you do that sometimes.
Always.
Oh, he always. Oh, so for him, for sure. Then. So for him, so between the knees then. So then this would be his position.
I
Now,
have like 3 pillows, 2 underneath my head and 1 in my knee.
that's right. That's right. So how could he do it? He could put 2 pillows under the neck, and maybe he could scoot a little pillow in here and a little pillow here, and that would be a way of but somehow getting into this position would be great. How about let's go ahead and try it without these pillows. Let's go ahead and stand up again. Go ahead. And let's show us how you do sleep. So let me show us how your positioning that you like to sleep. Show us. Let's give you a pillow. So what kind of a pillow do you usually have?
Huge.
Oh, huge, really big pillow. Okay.
So my normal sleep position.
Yeah, you could show us, you know, how you do it. Okay, so that's usually how you do it.
Yeah.
Okay, so that would cause a lot of dysfunction here in the neck. So that could cause a compression of the nerve here and stuff here in the neck, could cause pain between the shoulder blades like you're having. So that could definitely be.
So the one you said now is.
Yeah. So then if you
like
get
this.
one arm back here like this would be great. So if you can get back here, but sometimes it feels more comfortable if you have something like pinning it a little bit. That's too thick. Yeah, too thick. So if you have something that kind of so roll backwards for a second. Roll backwards. So you have something you just put there, sort of makes you feel like you're in a cocoon or something that holds you in place. So something in the front and something in the back and something for your arm to fall on would be ideal. But now it's also nice to have something underneath the neck, like here you're kind of wrenching the neck a little bit. So it would be better to have this one here and have a really soft one under the neck. Let's try this, like super soft one, and have the head like that, and then the neck,
No.
something like that. Also would stop you from snoring.
I don't.
No snoring in his case. Okay. Or we could. This is a cervical roll. Let's try this one. So sometimes this could be a good choice, right there, and then. So what do you think that
Yeah,
feels?
this is good.
This is called a McKinsey cervical roll, and it looks really good on you there. And the guy over here, he sells it, but you would get it on the internet too.
Okay.
McKinsey cervical roll. But this looks really good. Yeah. So it's taking up the space here. You're taking up this here. So I recommend this. This would be really good for you, like this. Yeah. So this will work for him. Yeah. All right. So we corrected the sleep posture. Yay! So that'll help. All right. So let's check the one of the range of motion tests. Oh yeah, you passed that. Yeah.
guys remember that?
I
Scalene.
was just gonna check your scalenes. Oh, you don't have nerve compression in the neck. Yeah. So good. You don't have that. Okay, so we're gonna check a few more things. Let's have you go ahead and sit up and then stand up. Okay, so we had a few more underlying perpetuating factors to check, and one of them is supersensitive spinal segments.
Mm-hmm.
So in the upper body.
Now, we've
So
been
let's-
doing that this whole time, haven't we?
We have
We've
been.
already been doing that. But, you know, we incorporate that into every treatment protocol. Might as well
That's
just
true.
check the nerve roots that are supplying the muscles that
That's
we're
right.
testing.
That's right.
But it is, in actuality, also considered a separate perpetuating factor.
It is. So it's the nerve roots here. So if you have like so he was really tight here, C6, so that could cause pain and dysfunction throughout the arm, but also activate some of the muscles that go down in between the shoulder blades where he has the pain.
Yeah.
So let's take a look at and see if he's got any supersensitive spinal segments.
Now,
Okay.
just to show you guys right here.
So here, let's stand this thing. Good. So not bad here. So this is not too tight.
It
Is
isn't
that
one
painful?
listed,
Is that
so
painful?
that's why we have these
Okay.
extra
Little bit.
boxes. You could just put
But here is too tight. See here, starting here about
super
C4,
sensitive spinal
that's too tight.
segments. She calls it
Too tight here. This
SSSS.
is too tight here.
And then that's
Too
531.
tight all the way through here. Okay, so here, so all through here, from C4 to about T
Show
1,
us
2,
again.
3, 4 to T3, he's got super sensitive spinal segments.
You want to show it to us again?
So show it again.
Yeah.
Yeah. Okay, so here, so with the head in the neutral position, you can see, oh, this is nice and loose there, but oh, you get to one, oh, here now, oh, it doesn't come up. So starting about 3, 4, and then here it doesn't, you can't get it to come up. So C6, C7, T1, T2, no coming up at all.
Yeah.
And here, starting here, it starts to come up. So here you have a, but again, at the lower part here, around T12,
Okay.
it starts to get too tight again. And then in the L's as well. So that's next
So
week.
we would write these results down here. Sensitive spinal segments were positive for
And also here.
C3. What did you say? C.
C4
Oh,
and
yeah,
T.
right here. So here, so T, look, T1, 2, 3, 4. So starting around T8 through L3.
T8 through L3.
No, L4. And L5. No, even the S's. So all the way down through the S's. So it's like T3,
T8
yeah,
through
all
S.
the way through the S's. So we have a lot of areas along the spine that are causing it to have dysfunction. Yeah. So if we corrected your posture, it would help that. So that would be important. So
You guys know what you would do with those super sensitive spinal segments, right?
could I have the 6s back? Oh, maybe I took them, huh?
No, really.
We would use our heat and compression.
Okay,
I was
great.
holding on to them for you.
Well, thank you. Okay, so let's try it with these on and see if it makes a difference. Okay, so
She's all about the one-hit
So-
wonder. Here it goes. Can the first metatarsal deficit being corrected change?
anything,
Everything in the world.
everything. Okay, no, it didn't do it.
It didn't do it?
No.
Oh
It
my
didn't do
gosh.
it?
Throw 'em out.
Oh.
Throw 'em out.
Oh, it didn't do it.
Oh.
Okay.
Throw 'em out.
Anyways, but it was worth a try.
If only the president had
Yeah.
shoe inserts, he'd be
That's
brilliant.
right. So, many of the muscles that cause pain between the shoulder blades have nerve roots here. So that definitely could be some of your reason that you had the pain between the shoulder blades.
You
Yeah.
guys, of course, you wouldn't have any trouble knowing what to do, right? Because,
Yes.
pain between the shoulder blades, wait,
That's 11 and 12.
11 and 12.
Let's look at 11
See,
and 12.
11 and 12 right there. Maybe even a lower, maybe even 15, but 11, 12 right there. So you guys would go immediately and you would take the patient like this and you would say, okay, Tony, so where you've described your pain is right in that region right there. Where you see those numbers 11,
Yep.
12, and 15, right? Especially right around 12 maybe? Yeah, 11
Yeah,
and 12, yeah.
12 and 11.
Okay, so now if you look at 12 and 11, this is a list of the muscles that cause pain in that area. So upper thoracic pain number 11, you've got all these fancy muscles. We can test and evaluate each one of those muscles to find out whether it is the one contributing to your pain or isn't. And each one of those muscles has its own unique pain pattern. That's what's on the wall over here. Tony, come on over here with me. Let me show you. Like for example, the scalene muscles that were the first on both those lists are. Sharon knows these better than I do. Sharon, the scalene's on here?
Yes, they are right here. That's it. Right
Oh,
there.
scalene.
No, over here.
Oh.
That's it.
Ah, there you go. Scalenes in the blue section. Okay. All right. So the scalenes right here cause pain. See, in the middle, like you're describing, but also coming down the arm, back of the hand. Do you ever get any pain here, or running into the chest like this?
Well, the thing is it's chronic. When it's chronic, a lot of times all you feel is it right here. So when it's in its chronic condition, you only feel the pain between the shoulder blade right there. And when it's in this one here, which is below it, when it's in its chronic condition, often you may only just feel the pain right there. So the combination of the two, the anterior serratus one here and the scalene right there, could give you pain throughout the shoulder blade and below it right there.
Sure, but he didn't express that he had a lot of this.
No,
Pain
not
right
down the arm. No.
Now,
More here.
right now, did that corroborate with? Yeah, when Tony was lying on his side, Sharon quickly grabbed a quick test of the scalene test. So when your fingers when they can't close, when they're open like this, that's a sign that the scalene muscle is tight. And then this pain pattern is a sign that the scalene muscle is a problem. So based on the fact that you don't experience pain in that pattern and that you pass this test, the likelihood that is low that the scalene is the muscle causing the majority of your problem, right? So then we would just go to the next muscle on the list. Just go right down, looking at number 11, levator scapula,
That's
and
the next
levator
one.
scapula.
That's the next most likely.
Yeah, next most likely. How come I can't get my, because the camera's there. Okay. Right there. Or go down the list, and it could be anterior serratus might be a big one, right?
That would be right there.
And that's
So
that
that'd be
one right
that causes really bad pain between the shoulder blades, and we have a nice test for that one.
Yeah. So we have a 3-part test, Tony. The way we test, number 1 is where is the pain? What does it look like? The pain pattern that it looks most like gives us an indication of what muscle it is. You see how each one of these muscles has a unique pain pattern? Okay? And the second is we do a range of motion test. So like the scalene test with the fingers, well, there's a test for every single muscle also. And with the ones that don't pass their test, those are more likely to cause severe pain. And the third, the real bread and butter, is called palpation. That means Sharon will take her fingers. Her hands have become like diagnostic instruments. After palpating muscles for so long, she can feel whether the tone of the muscle is correct or not, whether there's knots or taut bands or areas where there's uneven tone in the muscle, and those are called trigger points. And that trigger point is the thing that we diagnose and correct. So with that 3-step process of pain pattern, range of motion test, and palpation, we can diagnose very accurately which of these muscles is causing the problem that you're having, and then we can teach you how to take care of that muscle yourself, and we'll treat it for you too, and that is why we're so successful.
What if you have the underlying perpetuating factor of the Morton's foot?
Yes.
That causes you to have the head forward, which then causes you to constantly cause pain recreating it.
Exactly. So it would be a perfect system if it weren't for the fact that we have underlying perpetuating factors. So that is like the secret 4th part of our assessment. So, pain pattern, range of motion test, and palpation, and then cover all the underlying perpetuating factors to make sure it doesn't come back. Okay, that in a nutshell is the diagnostic portion of myofascial trigger point therapy, and that's why this chart is a Rosetta Stone. It's got everything you need to know to effectively diagnose which muscle is causing this problem.
Except the underlying perpetuating.
Yeah, except for the underlying perpetuating factors, which is why we're spending 3 classes on it.
That's right. So one of the things for underlying perpetuating factor for seated is that. So let's get the 12 millimeter under his short side. So let's put it over here.
Okay.
Sharon, will you show again how he passed the short upper arms test?
Oh, okay.
So the short upper arms.
Somebody wants to know.
Yeah.
Okay, so we did. I did it
She
so
did it really
fast.
fast.
It was
I
so
didn't even see
fast.
it was so fast.
Well, we're going
so
through. Yeah, we'll be going through them again, but.
Okay. So here, what you want to look is for the top of the ilium. So you feel the top of the ilium, and you can see his arm, and you want to see both sides. So you want to get the top of both iliums, You can see his elbow touches your finger here, so he does not have short upper arms.
But President Kennedy,
He did.
he did.
He did.
And so,
But it caused him to have a lot of pain and dysfunction.
so his doctor, who
Dr.
worked in the White
Travell.
House, Dr.
And sit
Travell,
down there.
would have him put his hand in his pocket to keep his shoulder up.
Yeah.
Yep.
So, yeah, so to keep his from having so much stress, because whenever you have short upper arms, you're always holding your shoulders up like this.
Yeah.
And so one way of giving him a little rest is to put your hands in the pockets, and that gives you a little bit of rest.
And she built a special custom rocking chair that sold for a lot of money recently, that had elevated armrests for his arm stress.
Yeah, so that was nice. That was Sotheby's sold it. But it was a Sears chair. It was a mother's nursing chair.
Ah.
So it was set up with the elbows really in a good position for him.
Yeah.
Because it was set up to have for nursing mothers. Yeah.
Yeah. Okay. Cool. But
Okay, so-
he didn't have that, Tony.
Okay, but look at here. So he was concerned about his posture a little bit, right?
Mhm.
So here he has a little bit rounded shoulder. So one thing that you want to do is every time you're seated, you want to put like something like this underneath, and you want to get your head back. You want to and get your butt back too. So get your butt back. So put your butt back, and then get this. And it wants to be this sort of the apex of the rounding, and get it there. And then you want your head like that. And you've got your evening out this way, that way with your butt lift.
Yeah.
And then here, this would be taking away a lot of tension in the neck and shoulders. So tell me, how's the back pain feel right now? Your upper back pain.
It's okay.
But the level of pain.
No, I don't feel it like that much.
He doesn't feel it now. So I'm just saying, this is what happened at the failed surgery clinic. People would come in, I would do this. They would have like elephantitis of one arm. They would be on a morphine pump. I just do what I just did to you. And they would go, and they start crying because they didn't have the pain anymore. So in other words, if we don't correct this before the surgeries, then this needs to be corrected after.
It's got to be corrected eventually.
So this would help them a lot. And also, I can feel he feels really relaxed right now. You know, the shoulder.
So,
and neck. Yeah, I can feel
what pillow
nice and
did you
relaxed.
just use there, Sharon? Can you tell us?
Say, this is a
Can you show
pillow.
us that pillow?
So this is, I like this pillow. It's made of memory foam, but see how thin it is? And it's really thin, but it has this apex right here. So I like to put it at kind of the apex of the rounding to contradict the rounding. Okay? And then the person can get their head back. Otherwise, if you don't have this in, your head goes like this.
So you put it at the apex of the lumbar spine?
Here, so I put it below the shoulder blades right there, usually. Right there. So what I want is, this is how I want people to think. I want their shoulder blades to be feel like they're on a shelf. Like get the shoulder blades on a little shelf.
Mm-hmm.
So how's that feel? Okay?
Yeah, it feels good when I stretch my shoulders back.
See, comes back like that. Yeah, now you can do that.
Yeah,
So there's a
that's why-
tendency. So I find that myself too, that if I don't have this in my car, if I don't have it in my airline seats, if I don't have it where I'm seated in front of my computer, I do like he was just doing a minute ago, and I just go like you just tend to go like that. You just do. But this is so comfortable because it's so thin, and it sticks right where you put it, and then it makes your head. So when I'm in the car, I practice putting my head on the headrest like here, and I get it back all the time. Then also I stretch in this position, in the correct position. You know, I get it all stretched.
Where can you get a pillow like that? I'm sure everybody knows Amazon, right?
But I got it at the Relax Your Back store.
Back store.
Yeah, it's like $35 or so. They sell it like they have it, and they can send it to you immediately. Yeah.
Okay, and I use the I find that the
this
manual from my car is the perfect thickness for mine, and I just shove it right behind my back. So I mean, you can use just about anything. The trick is, does it cause the relaxation that we're looking for?
So here, we can use the McKinsey roll too. So we can put the McKinsey roll right here underneath the shoulder blades, right there.
A shelf for the shoulder blades, guys.
Shelf for the shoulder
blades.
Right. So you're trying to, or you just get a rolled up shirt and put it right there.
Towel.
A rolled up towel. Just stick something there because you got to put it there. Otherwise, you're really causing your head to go forward.
Especially car seats are so funny in their design.
And airline seats.
And airline seats, so you
don't.
This, way forward. You just don't know what's going to work for everybody.
No.
But find something that does. And don't be ashamed to go out to the car with your patient and see how they're doing. Because there's a couple other things in the car too, like seats that tilt the knees up too high, and that jam up into the hamstrings and cause compression of the hamstrings the entire time they're driving. There's all sorts of things in the car. But okay, so she is almost done taking a look at this. We haven't done breathing yet, Sharon?
No, we're going to do that.
Okay.
But let's do that. We have our time for.
Yep, we've got like 3 minutes left before our break.
We have 3 minutes left before our break. So let's all of us. We're going to do a little bit of perpetuating factor breathing. Okay, so let's have you put one hand on your neck over here, and one hand on your tummy, and you're going to inhale. Just inhale, and relax. Okay, inhale, tummy out. Inhale, tummy goes out. And relax. So everybody, we now have a really important underlining perpetuating factor.
You can see. You can see at first breath his tummy didn't move.
Every single person that came into the fibromyalgia clinic and to the failed surgery clinic had this, what he just had there. So we'll check this on everybody in the viewing audience, and then when we come back, we'll talk about how we can correct it.
Okay. Do it one more time. Want to show us? Take a nice breath there. Deep breath in.
So
yes, please.
So so I don't encourage them to do the wrong thing. I don't tell them to take a deep breath. So I just tell them to take a normal, relaxing breath.
Okay. Because
otherwise, they almost always do it on purpose.
Okay.
Yeah.
So take a normal, relaxing breath.
Yeah. Yeah. So So this would be one of the biggest.
You see the chest moving, and you see the abdomen not moving.
So this is one of the biggest causes of upper body pain and dysfunction. Is this kind of breathing that Tony is doing?
Yes. So let's.
So we're gonna have to. So write that down as well.
Write that down as well.
We got So I thought, Tony, I thought I had this clinic where I took care of people after 5, 10, 15 operations, and after they had 10 years of pain, I thought, why don't I come down here and help people before they have all those problems? And why don't we fix you before all of the problems?
Right.
Yeah, and fix it before you end up becoming a person who has to take too many pain pills.
So
like
you see,
You
see during an evaluation, Sharon has just demonstrated that she covered the small hemipelvis, posture, sleep position, Morton's foot, short upper arms, breathing, and suprasensitive spinal segments. Those are the things that she covered. So you could see how you could break it out and do maybe 2 or 3 for the, let's say your evaluation is an ongoing process. You tell your patients, my evaluation is an ongoing process, and over the first 3 weeks, I'm going to make sure and finish evaluating all of your underlying perpetuating factors. You don't have to do them all in once. So Sharon just did a quick run through of all of the major underlying perpetuating factors. She even has some nutrition ones that, for people who are interested in nutrition, things, there are nutritional factors that play a role too. So obviously the way people eat affects their muscle tone and things like that too. So, all right, we are going to take a break. Thanks for being with us the first hour, and we'll be back to go through them a little more slowly so you can understand and learn how to do them yourselves, okay?
If Bill asks, tell him I'm getting treated here for my back.
Okay. Don't tell him.
Don't tell him anything about the webinar or anything.
Okay, don't tell him anything. Okay, got it.
Just tell him I'm getting treated, that's fine. Because he'll tell my mom, she'll kill me.
Oh, she will? She doesn't believe in
She'll get
this?
me back to it.
Where's
No, it's not that she doesn't believe in any of this. She doesn't even know I come downstairs to Bill every day. She only wants me to study.
Oh, she only wants you to study?
I
She
don't
doesn't
work
really
here,
work?
I just help these people out. I don't
So
get
he
paid
doesn't-
for
He
anything.
doesn't get paid even. Oh
You don't
man,
get paid,
he's just
you just
helping.
help?
He's just helping.
Yeah, they are my neighbors from 20 years.
Get support from your feet too. That's really important too. When you have your feet back.
That's what
Support from your feet. That's really important too. When you have your legs back like that, you're gonna go forward. So you need support from your feet. Okay. Oh,
He's
you're
comfortable.
comfortable. You're comfortable. Okay, then stay there if you're comfortable.
Maybe the shoulder blade.
Yeah, it's comfortable.
Yeah, so usually. So we want you to have this up high, and this down low. That usually makes the shoulders. Well, it's pretty close to.
Yeah.
When you're ready,
we
when you're
had
ready.
the office ergonomics classes every once in a while. I flunked all of them.
Yeah, well, that's because they weren't corrected, the things you didn't correct.
Yeah, the correct. Every month
Yeah.
we used to have office ergonomics. I work for GE, not IBM.
Oh, sorry. TE.
Yeah, General Electric. So they used to get these things done, checked every day. But whatever they said, I always used to end up like this, like this.
Well, that's because, well, the thing is nothing's really being corrected. You know, they think they're correcting it, but they're not. They're trying to make a correction for everybody, and it's not. It's not really fixing. What happened is they spend millions of dollars on ergonomics, but then people after a short time all have all the pains again.
Yeah, everyone will have the same.
Yeah, everything comes back.
And you
because,
know what?
yeah.
I tried the yoga. There is a stretch, a position called Dhanurvasa,
Mhm.
the bow pose.
Yeah.
I tried the bow pose.
Bow pose?
Yeah, to see if that helps.
Yeah.
Then I hit the bench in the gym to see if that helps.
Yeah, so
I tried
put the
everything.
butt back a little bit. Yeah. And then you get this up a little higher. Okay, so the thing is though, if we could do these things that I'm showing, we could. They never put a lift under one side. They never put something under your feet. See that's what I found is that when people came in, they didn't have the little problems you got, but they were really bad. I mean, after 15 operations, and really they had what you have right now. They had just what you had.
Okay.
So the thing is if we don't correct it, then you're in danger.
End up at 15 operations.
You're
We hope not.
You're in danger of having all these bad things done that you don't need necessarily. But you just need to correct these things that we're showing. Okay, so the breathing, what you want to do is so you want to be able to breathe in such a way as this part doesn't go up, the upper part doesn't go up and down. So you want to, you don't want to breathe. So you don't want to breathe in such a way that this part. So it's like you're a smoker. Like this, you're breathing with your upper body every breath.
Yes, I'm a smoker.
What?
You're a smoker? You are?
Yeah.
Oh, well you're breathing like
You
a
breathe
smoker.
like a smoker.
You breathe like a smoker.
I'm a smoker.
Well, we could train you not to breathe like that maybe when you're not smoking.
And hopefully you can quit. Because that was your best
Okay,
thing.
So I will soon.
Yeah.
Okay.
So
You wanna
well,
quit?
it's good. Whenever someone quits, it's always good.
Yeah.
So
I'm not like a very heavy smoker. I do like maybe 3 cigarettes a day.
that's not so good. So these muscles here can get into dysfunction. So what you want to do is practice standing, seated, and walking. How to breathe where you're not lifting your shoulders. So you put one hand here. Good. So it's easy to do. Good. So some people find they can just change just like that. So some people.
With practice.
Yeah, people do it. Yeah. So they just so I'd say just practice it walking, practice it seated, practice it laying down, and pretty soon you're doing it. So many people it takes away all the pain. So the combination, that's good. You treat all the muscles too. You know, treat the muscles, but don't recreate them. So that's what we're trying to do. It feels really good to be in the position that you want to do it.
I sit very little.
Sleep very
I
little.
sit very little.
Oh, look, you hardly
Very
ever.
little?
Yeah.
Okay.
I hardly ever. Even if I'm home, I just lie down in the couch and do whatever. I don't sit.
It's because you notice it's not so good.
Because if I sit for a little while, my back's not sleeping.
Yeah, so you might as well not get all the
Yeah, you
so
see
that
what
way
we
you get
did.
Love
We
it.
all are
Yeah,
just
yeah.
lavish.
Yes, you've learned not to do that. Yeah. Okay, so I think you could learn everything. Okay, good. All right, so we're gonna have you sit so that we can see you be at the computer. Okay, if you could move your chair over here. Yeah, put that under. So you put that under your sit bone,
Okay.
and then scoot a hair closer, maybe. Okay. Okay, good. And then put the keyboard in your lap.
Do you need your glasses?
Yeah, so that would be it. Yeah, good.
That's the one next to
Okay, okay, this. Okay,
The mouse. I do the mouse this way.
Or you
this area too. Right, and you put one of
sit back as much as you can. We're moving you all over the place.
So that is this too.
Himalayan salt crystal lamp.
It's a big thing of salt. We could grind it, and make it.
It's Indian.
Oh yeah, from Himalaya. Yeah.
Himalayas.
I know because it's Indian.
He knows everything about that.
There is this Ajanta and Ellora caves and the Bora caves where sunlight reflects onto these crystallines and comes out in multiple colors. Those caves are a tourist location in my state. So I know them.
My son imports them up and from
Put
here.
your feet forward, remember that. So you get support. There you go. That makes a difference too.
Okay, so
It takes a while to get used to it.
A good posture, yeah.
Yeah, I pretty much don't type anything on my computer now. Everything is voice.
wow. Okay, so that made a big difference for you. Yeah.
I hardly. It's my couch
Yeah.
for everything.
Well, I think it's probably a good strategy. Yeah, but in addition
There
to
is
that, we want
Croana.
to be able to get to you where you could sit if you wanted to.
Yeah.
Yeah.
There is Cortana for Windows now, and there is Siri for iOS. So
Yeah. So it'd be nice to be able to sit if you wanted to, but certainly that was a good strategy to not sit. Okay, so let's put the butt further back and let's put this a little higher. Yeah, and yeah, that's it in the head. There you go. Okay. Okay, it's time. It's time. Okay. Okay, it's time. Let's see what I think I might have done something wrong here. Can you see? Okay, good. Okay, good. Okay, so here we are. This way, yeah. Okay. Oh, do you think I have it upside down? I think I do.
Yes.
Yes. Okay. 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 So we're looking at perpetuating factors, and one thing that we're looking at is we're looking at paradoxical breathing. Another thing is we're looking at just the seated position. That we're in the seated position, and we put the thoracic lumbar support here, and his head's coming back pretty good there. Hi, who's joining us there? Hey. Okay, so and then we always like to put everyone's keyboard on their lap, and then we have them look at their screen at about eye level, or a little bit lower is fine as well. So this would be the best way. And he's decided not to sit at all, right? You were saying?
Yeah.
He hasn't been sitting at all because the pain of sitting is too horrible. He doesn't sit, and he just uses would you say that you did instead? Voice. He just uses voice. Yeah, now.
Siri, it types everything in for me.
He does it everything. It works for him. Yeah, but we also would like to be able to sit if you wanted to. Yeah. Okay, so let's review the breathing. Can you hold this here? Okay, so when you're seated, on your tummy, and one hand on your chest, like one hand here, and then like maybe right on your neck, and then you want to do is inhale, tummy goes out. Exhale, tummy goes in. and not lift up the shoulders. So notice, okay, inhale, tummy goes out. Good. You could do it immediately. And exhale. Inhale, tummy goes out. Okay, so you definitely could do it. So no question about it. So let's
I was in yoga.
he's done yoga before.
Oh, yeah, that's shameful.
So what you want to do is not lift up your shoulders, and learn to like just do it standing, seated, laying down when you're everything with.
I just need some practice.
You could do it with just practice. Yes,
Yeah.
I think I've had many people learn to do it only a few weeks, and others took longer. But even someone could learn it in as little as only a short
But yeah,
time.
if that's gonna decrease the pain, I'm gonna
Totally.
do whatever.
He will. If it's going to decrease the pain, he will do it.
Yay.
Okay, let's do it standing. Let's try it standing. Okay, so, oh, and by the way, he did have his ischial lift and his back support there. For
Ah,
him.
yes.
Yeah. Okay, so, so go ahead and stand up and do it. So go ahead and, so one hand there, and the inhale, tummy goes out. And see if you could not lift the shoulders. So keep the, and inhale, tummy goes out. Yeah.
Part one of the three-part breath.
Right. And inhale, tummy goes out. Yep. Good.
Do you remember what
So-
that's called in yoga?
In yoga,
Tony,
what do
the
we call
three-part
the
breath?
three-part? So then we would go up, and
I don't remember.
we would also go up and expand the upper chest as well.
Yeah. The
But in this
three-part-
case, that's not what we love that.
Yeah.
But
We
that's
used
not
to do it faster. It was like something like this.
okay. So that's
With
one
the
of
tummy.
Yeah.
That's the
Yeah.
breathing exercise.
yeah. So sometimes that actually activates. I had one person that we fixed, and then they did that kind of breathing, and then it caused them to get all activated again. It was very disappointing. Yeah. Okay. So you're just gonna practice. So and not lifting up here.
Yep.
Yeah. So it's just so he's gonna learn to do. So we'll check that a few times.
What else might cause someone to breathe through their chest instead of?
Okay, so let's look at it. Let's turn this way.
What
So
might-
one reason would be their abdominal muscles are tight.
Weak.
Okay, so right here, yeah. So I would say, so what happens is the abdominal muscles are pulling the chest this way, and then when you inhale, the tummy muscles don't want to go out. Okay, so that's a little painful, right?
Yeah.
Yeah, it was kind of painful. So the abdominals are pulling you probably forward like this. Yeah. So they learn to be short. So we have to
Yeah.
get them. So what if they learn to be long? Then you'd be like effortlessly standing and effortlessly seated. So these here we have to get them to be just a little longer.
Okay,
Yeah.
what's another reason? Another reason why someone might learn to be a chest breather instead of a abdominal breather.
Because they're holding their tummy in.
They wanna look good.
They want to look really nice and thin.
Yes.
So like everyone try it. So if you hold your tummy in
Small
like this,
tummy, big chest.
so we're holding our tummy in.
That's
then we
how
have to-
all good people look. Good-looking people,
Like
they'll look like that.
Mr. America, right?
Yeah.
You gotta get your chest out there and get your tummy way in like that. But then that causes you to not be able to causes a lot of pain in the neck and shoulders. Yeah.
Right. Great.
Yeah,
Okay. How about one last reason? Why would somebody breathe shallow and in their chest?
Instead of using their abdominals.
Yeah, instead of a nice, a more relaxed.
So why would they do it?
abdominal
Because they
breath.
smoke.
Maybe smoking. Yeah.
Because they smoke, and there's a tendency to do that when you're a smoker. So when you're a
Exactly.
smoker, you tend to use these muscles here.
To draw that in. Yeah.
You could draw in here.
Someone said beer gut. If you have a lot of swelling in your abdomen, you may learn to be a chest breather because you've got such a swollen gut. And what about just anxiety?
Well, a lot of the beer gut has a lot to do with the muscle isn't working anymore. So then, if it's not working, it's hard to make it do its job.
Well, yes. Plus, people run out of space in the abdomen
Yes.
to
Can't
expand
inhale.
into. Yeah. And that's right. So anxiety, asthma, these are all big important factors. But if you aren't, if you know someone has a lot of anxiety and you don't deal with anxiety, then you might want to suggest they see someone about anxiety. And then the combination of you working on breathing, that's like a physical way to treat anxiety, and them working with anxiety, which is an emotional way to treat the neck, then you can work together real well. So that's
So some of the
Important.
muscles that we want to look at is short abdominals, and another one is short pecs.
okay.
So let's check to see if he's got short pecs here.
Okay, great.
So we're going to go ahead and listen to your watch, and take your arm back, and so you can feel a little bit of tension right here, so the pec's a little tight there. Let's look at the pec major, and you can see, yeah, right here, pec major. So right here, you can see.
How far should it be able to go?
You should be, I can feel the dysfunction, so you can feel that it's not.
So it's an
right
end
there.
range feel?
Yeah, end range feel right there. And here I felt some little noises in the shoulder. Okay, so here we want the pec, the middle pec to, the upper pec is tight right here. I can feel it doesn't want to come back. And there too. And let's listen to let's do the pec minor. So listen to your watch, like here. Take your arm back. Oh, this one doesn't want to go back, see? So it's like a feel, you can see it doesn't want to go back. So the pecs and the abdominals are pulling you forward, causing a little trouble.
There you go. There you go.
So this would be part of what's causing trouble here, is because if these are pulling you forward, then these have to constantly work,
To keep me back.
Keep. Oh, you gotta keep. Get there. So let's check. Another thing would be not having the minimum strength. So
Minimum strength?
Mm-hmm. So we're gonna check for the minimum strength for the posture muscles as well. So we're gonna do that as well. So we're gonna check that. So minimum strength. So let's see if we can find some really strong muscles. So let's go ahead. Let's go ahead and do the Kraus-Weber minimum fitness test. So let's have you go ahead and lay on your back.
What subject are we covering right now? We're
just checking the strength of the posture muscles.
So an underlying perpetuating factor
would be not having minimum strength of the posture muscles.
Yeah. Okay. So there's a Kraus-Weber test that is that tests for some minimum
strength and flexibility.
Yes, minimum conditioning. For you to, without this minimum strength, flexibility, and strength test, if you don't pass them, then that deconditioning is a perpetuating factor that keeps pain coming back.
Yes, and our teacher, Bonnie Pruden, made the point that all of us, my age and younger, all of us, most of you out in the viewing audience, don't have the strength that you need for your posture or your flexibility.
So may I have that sheet?
You may have.
Or let's see, which is this one here. Yeah.
Okay.
So.
Hold that. You want
Yeah, I want to document here again. See on this date.
So for this, we're gonna have you do.
Can you wait, sweetheart? Hold on.
I'll wait. Okay, I'm gonna wait.
Okay. So right here, and we did the Kraus-Weber. That's K
Hold your feet. And then
W.
have you come up into
Kraus-Weber test, and this is 531,
you
and results we'll find out. There are 6 tests he has to pass. Okay.
No, we do that for 6 pack.
Okay.
Yes, we do it first.
Sharon, is
Okay.
it 6 tests he has to pass? Is that what it is?
Yes,
Is it 6?
yeah. So we're gonna see if you can pass the 6-pack test here. So
Okay.
let's go ahead and come up like an airplane. Put your hands like your elbows come on up. And he passes. Okay. So the next test we're gonna test
Okay.
is
What's that one? He has to be
that
able
was
to
the
do that.
abdominals.
Okay.
That was for the abdominals. This is for the abdominals and the psoas. Okay. So same thing. Come
I
on up.
did this too.
He always does this. Oh, he does this when he's passing with flying colors there.
Okay. No problems there.
Okay, so now we're going to test the psoas by itself.
So it's by itself.
So here you're going to keep your back flat. So put one hand underneath here so you can feel your low back. So feel your back flat against the table. Okay, and you're going to, I'll hold your legs up for a second. Let me hold them up. Okay, now you're going to hold them up for a count of 10. Let your head rest. Hold your legs up for a count of 10, but keep your back flat.
Okay.
1, 1,000, 2, 1,000, 3, 1,000, 4, 5, 6, 7, 8, 9, and 10. And relax. How did that feel? Was it okay?
Lower abs.
Was it a little hard, that one? But you did it.
Yeah, lower abs.
Yes, lower abs. That was good. He did it.
Passed
He
it.
did it. Okay,
Good.
go lay on your tummy. Oh, he's passing these. He's going to pass everything.
So
He's passing it all.
deconditioning so far hasn't shown up as a
No,
perpetuating
he's having no
factor.
trouble with that. Okay, I'm going to put a little weight here. Now lift your upper torso up. Lift up. Up.
So he's gonna do-
1. Oh, that's a little hard. 2, 3, 4, 5, 6, 7, 8, 9, and 10. You could do it, but you didn't lift very high. So this would be these
Yeah,
muscles.
that's because of the pain.
That's it. So for this one, we want to get a little bit. So the upper
Okay,
back.
so we would
okay?
say, what was that? It
So
was
we're going to let your head
4.
rest.
Test number
Rest.
4.
Yeah, sorry. Okay,
You didn't pass test number 4.
and let's go ahead and lift your legs up towards the ceiling, both legs together, and hold them there. 1,000, 2, 3, 4, 5, 6, and 10, and relax. Okay, good. You pass. And then the last one is you touch your toes. So let's go ahead and have you stand up and
Okay.
see if you can touch
I
your
can't.
toes. Can't touch your toes?
I know it from here, so I can't.
Okay, so let's
See
go
how far
see.
you can go.
So, okay, so minus about a few inches there. So that's almost pass.
Okay.
Almost pass. So a check for also we can check for scoliosis as
So
well.
again, we go
So let's
here.
Go ahead and just have you go slowly towards your toes. Go slowly towards your toes. Okay, so here you can see that we have a little bit of a scoliotic. So here you can see that. Okay, come up slowly. So here we got developed over here and over here. And we kind of have a curve coming like this, like that, like we saw
Are
earlier.
you right-handed?
Yeah.
It's considered to be normal to have a little bit of a right-handed curve
Yeah.
if you're
Yeah.
curved to the
Okay,
right.
so but it was more of a that was significant though when he would bend over. You can see
Well,
this
show
was,
it- show us
one
that
more
again.
time. Go ahead, lean forward. You see how this here and then here. So this is bigger here and this is bigger here.
Is that
Yeah.
part of the Cross-Weber, or is
Yes,
that?
it is. It's part of the
Okay.
Cross-Weber test. Yeah.
Yeah, okay.
So we
That's
usually
part of number
check.
6.
Yeah, that's what we check for that. So this would be a slight scoliosis. So let's put in the shoe inserts. And let's see how
Okay,
that-
give us a
Great.
second.
Go.
So, Stephanie recorded right here.
So if you
So
could put
Kraus-Weber,
right
sorry
here.
for my handwriting again, I'm holding the camera at the same time, but it's so 531
Okay,
passed,
try it
1, 2, 3, and 5, and 4 and 6 didn't pass. Okay? And
Yeah,
obviously you
so
could
it
have
stays
more
the same.
detailed notes,
Mhm,
you know,
yeah.
on anything in your exam forms. But it's nice to have that nice tracking sheet so you can make sure that all the
Okay, great.
perpetuating factors have been covered.
Okay, super. So we covered a lot. A lot of underlying perpetuating factors. So we found a lot of interesting things to correct on you, didn't we? Yeah. You're gonna be a new man.
Breathing.
You're gonna be a new man.
So should
So-
we cover just the upper body ones in detail so people can
Yeah.
see exactly how to do them?
Again.
Well, we didn't explain how we were doing them very well.
Oh well, you go ahead. I don't know what you mean. So
Okay.
go ahead.
So,
So
for
go ahead.
example, let's
So go ahead. So,
so
a lot
let's-
of the ones that we worked over today,
so small hemipelvis.
the small hemipelvis is really important for the upper body.
Okay, so
Really important. So he had that. So he was short about 12 millimeters. Then we had posture. So he was with his head forward, and also he had kyphosis. So head forward and kyphosis, and sleep position. He was doing the sideline, but he was kind of in a fetal position, and also like with the pecs all shortened. So that was really a problem. Another thing we found was he has Morton's foot, and by correcting that, we corrected all kinds of problems. So we corrected the uneven shoulders, uneven hips. We corrected that so that would be really important for upper body and between the shoulder pain. We didn't have short upper arms. That was good. We have a breathing problem that we think we can correct almost right away. So we'll check him on that in a couple weeks to see if we fixed it. And then here we have super sensitive spinal segments. We found quite a few of those, so we could definitely correct that as well. And then we found that we just had in the Cross-Weber minimum fitness test, all we had was the flexibility as a problem.
Okay, so can we explain how to do them now? Like each one explain how to do them, not just the results for him. For example, like we haven't mentioned all the things you should look for when doing posture, and we haven't said how to do the small hemipelvis evaluation, and then what the findings would be, for example, or what the symptoms might be. So to explain how to do each one, so everyone can see how to do it, so they feel like they can do it, because and then what we should exactly look for with breathing and things like that. Do you want me to cover those, or you can? So. We'll put this form like for posture, for example. So let's take a look at the form that we have for that. We have a perpetuating factors evaluation form like this. And this is so when you're doing a posture evaluation, you'll do seated and standing. So you can see that we have seated right here. Sorry. And we have standing. And these are the things that you look for. So also you can see that they can be done with shoes on or shoes off. And then, of course, Sharon showed that they can be done with the lifts for the first metatarsal lift in or out. But so, Sharon, do you want to explain how you go through each one of these?
Okay, so I just choose which ones I want to do, and I only do the ones I want to do, so I don't do all of them necessarily. But all I do, so I look at the ears and I see if they're even.
She looks at
Go like
ears,
that,
see if
but
they're
maybe
even.
I don't care about that, so I don't put it in. So then I look here, so I look for all different sections, and I look, is it even? So but mainly what I'm doing is I'm pointing out the most important things that I'm finding. So the things that I found were really important were the different heights of the, so this could be done, but most of the time I don't do any of that because I only like pictures. I don't like any writing.
Sure.
Okay, so here, the head forward, I put yes, you have that. Straight upper arms, no, he didn't have that. Leg length, it was corrected. He did have different size hips, but it was corrected by doing the first metatarsal correction. Heel lift, he didn't need one because we did the first metatarsal correction and that corrected that. The small hemipelvis, he did have that, and he needed it on the right side, and he needed 12 millimeters. So that's usually what I do is I write that in.
So you remember how to do that, guys? You
I write
sit
it
the
in
patient
here.
down on a flat, hard surface, and then you look at the heights of those three areas Sharon is showing: the occiput, shoulders, and the top of the ilium right there, and to see if there's any unlevels, leveling, or if there's a scoliosis of any kind. And then you place the lift under one side, see if it corrects it. If it does, but not quite enough, add a little bit more. Or if it makes it worse or doesn't correct it, try the other side. And that'll give you an idea whether one half of the pelvis is smaller than the other. And that's a congenital defect that is there since birth. Some people actually are walking around with one smaller pelvis than the other. So we did find that exactly. Good. Some of these other ones, as Sharon said, we don't do a lot of these. More, we're looking at leveling those three areas: the occiput, the shoulders, and the pelvis.
So you had a little bit of a curve like that.
Yeah. So Sharon makes sure to identify how to level it when in the seated position and in the standing position. Leg length equality, we'll probably go that in more detail next time since that's a lower body perpetuating factor.
Well, it's also upper body, but
Well, they all affect each other.
yeah, thank you. So, no, not that page. Okay, so here it is. Okay, so here was the so this was his. So he was so I drew it. So when he was higher on one side, then I draw it like this, like that.
Yeah.
And then when he came like this, then I drew it like that. And then you see that he has like a curve like this.
Mm-hmm.
I usually draw that in. Also, here I noticed that his pelvis was tipped quite forward on the one side, but kind of normal on the other side.
Mm-hmm.
And so you just go to the anterior and the posterior iliac crest here into the anterior, and then you measure it there. So,
Perfect.
and then okay, so. What next, Justin?
So that covers this part that says posture here. So we're looking at one. That's what she does: posture, seated, standing. She makes sure that those three areas are level. And there's even a little thing if you want to draw that. Sleep. So for sleep, Sharon has more in her book on this, but we have a chart of the sleep postures that are good and the sleep postures that are bad, right?
Yep.
And so you would take that handout. Should I make sure that handout gets uploaded then?
That'd be good. That's a nice
Yeah.
handout.
Yeah.
That's a great handout.
Yep, and it shows you the sleep positions that are good and not. And so she asks the patient what is their preferred sleep posture and demonstrate that, and then show them the corrections so that you find something that's agreeable to the patient. Sometimes it's transitioning to the back, sometimes it's just fixing the side lying posture. And Sharon, is it pretty much never the case that stomach sleeping is okay?
Well, not generally because you're always always shortening one side and what if you did the exact opposite? I mean, maybe you could make it work,
Yeah.
but the likelihood of it working isn't too high.
Okay.
So usually you want to either be back sleeping or you want to do side sleeping with all kinds of bolsters and things like that.
Yeah, and the idea is not fully extended and not fully flexed, right?
Right, not fully
You
bent.
don't want it like that.
So you want to unbend the joints. So
Unbend
you want to
the
bend
joints.
unbend all the joints, and so you want, but not have them straight, but unbend everything.
Yeah, the knees, the hips, the
Mm-hmm.
yeah, and the shoulders. Okay, good. So sleep we did. Leg length we'll probably cover a little more last time. Morton's, remember we're gonna have a whole class on that, but she did show you how how impactful that one is.
Thank you. Good.
Short upper arms again. We showed that a couple of times. The elbows should come to the top of the iliac crest. If they don't, then the upper arm is short. And the correction for that, if you got short upper arms, you could find that in probably the big red books over there too.
Well, she might have it
She
in
might
there,
have it.
but usually what we did was we put actually it's not there.
Yeah, okay. It's not there, right?
What you want to do is put a lift underneath each arm, so when they're seated, so that they a pillow or something under each arm, and that would give you a good height for your shoulder. So if you want to go ahead and sit here for a second.
Yeah, let's pretend he had a short upper arm, and we wanted to keep his shoulders relaxed when he's seated.
Right. So go ahead and sit here for a second.
Let me get this from under here.
So if you had short upper arms and your arms were here,
Yep, it would be just
then
like that.
you put a sponge right here or something there, and you put something right here, and you stop it. So then the person who's got the short upper arms, they can't believe it. They go, "Oh my gosh, I can't believe how all the pain went away."
Yeah, otherwise all day, especially with his arms forward as he's typing or using them, there's no place for the elbow to rest, so it's a lot of tension building up in the neck and the shoulders. It can cause some nerve compression, and eventually they start developing some sort of nerve impingement syndromes down the arm. So for short upper arms, if they have it, find a pillow, or especially if they have a chair they use a lot, then Sharon will actually make kind of a homemade permanent
Yeah, so I could
lift.
take some sponges. I bring them with me sometimes to your office.
Yeah.
Then I take some duct tape and I duct tape it, and I put sponges here, and I put sponges here, and I put sponges under your feet, or wherever you need it.
And if his name is Bob, then he gets made fun of a lot in the office.
Yes, that's it.
Sponge Bob.
Yes.
But yeah, so that's it. So for short upper arms, we would put that. Yes, we evaluated it. He had it, and you put a 2-inch, sponge lift or something on his arms. Okay, breathing. Remember, we saw that one pretty easily. He puts his hand on his chest. He puts his hand on his abdomen, and the abdomen should go out first, maybe exclusively, but definitely first before there's any chest lifting. And if not, then we teach him. We just basically teach him to stay.
Train everyone to just use the lower area, because we don't want them to be lifting the shoulders up. And when you're singing, it's good to do that. So singing's good training. Sometimes that's a good way to do it. Learn how to sing without tightening up your neck.
Yeah. And we train them in seated, lying, and standing position.
That's right. It'd be good if you could do it. So usually what I do is put one hand on the chest, one on the neck, and take 5 minutes and walk, and just practice breathing while you're walking.
Or what if they played the piano and they had a lot of pain during playing the piano?
Yep.
Maybe as soon as they go to play the piano, they forget all about their breathing. So, whatever activity they're having pain in, make sure that they're not breathing paradoxically in that activity. Okay? Someone asked why their arms would be, with short upper arms, they don't get a rest because they're always hanging, whereas the rest of us get to rest our arms.
They say, oh, they're holding their shoulders up all the time. It's just so painful. It's so painful.
It feels like that because their arms never get a rest.
Never get a place to rest.
Never get a place to rest. Okay.
Right.
Good question. And I think that's it. Did we cover another one? I felt like there was another one you threw in there and I didn't. Oh, probably.
Super sensitive spinal
Oh
segments.
yeah. So you guys know about super sensitive spinal segments. That means that you do the skin rolling, right? We do the skin rolling.
So let's have you stand up again. So wherever we went and we lifted, so we found, so just have the, So here it was, but all was so tight right here.
Yep.
So that means that we have the nerve root is slightly being compressed, and it's expressing it in the skin and the fascia. And so when you come down here to grab the skin, it won't let you to do it.
Yeah.
So there would be all these the nerves that these muscles, all the muscles that this nerves go to could be in heightened tone and causing pain and dysfunction.
Yeah. So
Yeah.
again, when there's an slight impingement of the spinal nerve roots, one of the first ways that can be detected. Now, I know that also I used to do thermograms
Thermograms,
and electromyographs of the
Right.
spine too, and that's it. When there was an impingement of the nerve,
and it'd be cool.
there'd be a little cool temperature, or
It could be hot sometimes.
and the EMG would have heightened tone. So it's the little muscles in the skin and the fascia right here, right beneath the skin here, actually get increased tone, and that's why when you go to roll them, it's like you're one of the fanciest, best EMG machines. With your fingers have now become EMG machines, and you've detected increased muscle tone. If only you could stick your hands on the printer and it would print out a sheet. But but the patient can feel it oftentimes too. That area will be tender, right, Sharon? Won't it oftentimes be tender?
So often it will be tender to the touch as well, and it's a little
Yeah.
bit tender on you, isn't it? Yeah.
Yep.
Yeah. So he feels it tender right there as well.
And that's an incredible indication that you, as a person with just your hands, are deducing about a whole bunches of problems that could come in from the spine having increased tone of the skin.
Well,
like that.
Dr. Fisher was one of the top physiatrists in the world, teaching other doctors to evaluate supersensitive spinal segments and myofascial pain and dysfunction. He said it was more important than MRIs or X-rays. He said the skin rolling really tells you the information you need to know.
Amazing, yep. And you've seen Sharon corrected before, but in case someone has never seen the class before, Sharon, you go ahead and you treat the...
So what we want to do is treat the rotatories and the multifidus and the other paraspinals.
Those tiny, deep, intrinsic paraspinals that can compress the nerve.
Yeah.
Those are the ones we treat.
What they do is they pull the vertebrae together, and then they slightly compress the nerve, and then that causes the heightened tone in all the nerves distribution.
Yeah, and that's way sensitive, much more sensitive of a test than, for example, a needle EMG. I mean, why wait all the way down the road? If you could take every child, have them do the Krauss-Weber basic minimum fitness and do some skin rolling, you could avoid a lot of problems long before they start. And that was the other one that Sharon threw in there that I thought was really neat, and I didn't even know we were going to cover that today, is this Krauss, and I'll answer this question that's appearing in just a second. The Krauss-Weber minimum fitness test. Look it up. I'll write it down for you guys so you can see it. You can find it anywhere online. It's very famous. Krauss-Weber. Those are the names, I believe, of the two people. Minimum fitness.
Dr. Hans Kraus.
Hans Krauss. Minimum fitness test.
Yes.
If they cannot pass these minimum 6, and you remember those 6, so look these up, guys. Do a little homework on your own on these. Look at these 6. If they cannot pass those 6, then you know that they are actually deconditioned to the point that they will develop myofascial problems because their conditioning is too poor.
So here's my book, Trigger Point Therapy for Low Back Pain, and we put in here the general perpetuating factors, and we put in some of the major ones, and this would be mineral and vitamin deficiencies or insufficiencies.
Yeah, this book has all that information. It's awesome.
And we went around to all the myofascial doctors and asked them, well, what's the most likely muscles the most likely deficiencies that might cause muscle dysfunction? And they said that these were the most important ones here, and that they gave us the levels that they thought was real important. So you can pick that up out of our book, and that'd be great.
And we'll put up a little referral form where you could hand out the patient, say, I'm not a nutritionist, I'm not a medical doctor, but research showed that these minerals and vitamin deficiencies showed a correlation with a lot of myofascial pain. So if you want to bring this to your doctor, maybe he could run some tests and see how they are, see those levels. Okay, I think that's it. Was there anything else we did for upper body perpetuating factors
you could put,
that I missed?
Was this his?
That was his.
So also he had little bit of the scoliosis here. So
Yeah, right, in the posture, exactly.
yeah, like that. Yeah. So he had that too. So.
There you go. See how you guys can draw on that chart? So this is an example, but I'm going to upload these so you guys can have these forms. and begin to practice. I like this form because it reminds me that I have to do all those perpetuating factors. If I pull out a sheet for one of my interns and I look at the patient's not, they say, oh, I'm doing everything, but the patient's not getting better. And I look at the sheet and I see it's all blanked on here at the bottom. I said, wait a minute, you haven't done any perpetuating factors, you know? Or I can look at this compliance chart and say, wait a minute, he hasn't been on this, he's only come in 3 out of the 8 times he was supposed to in the last 4 weeks. You know, so something like that. But I really like these charts, and these perpetuating factors, I mean, it is bread and butter. Sharon does it so second nature, and I'm sorry I came back and did a little more review, but she almost, after 30 years, takes it for granted that everyone should know this stuff. It's amazing, even going through chiropractic school. I mean, I got to call myself doctor, and I didn't know any of these, okay? Except leg length is about the only one they taught us in chiropractic college.
See?
Yeah.
And that's why everybody ended up with these problems at the failed surgery clinic.
Oh, yeah.
And the thing that I was really wanting everyone to know is that, like, why don't we correct it? So I thought, why not I stop treating all these really, really bad chronic pain people, and why don't I just treat the average person and fix the stuff before? I said, why don't we fix it before they have the 15 operations?
Yeah.
Why don't we fix it before they have fibromyalgia or regional pain syndrome?
Anything beyond 7 operations is just set.
Anything beyond running exercise.
It's completely, yeah.
One operation.
Yeah,
If it takes a scalpel to fix your problem.
No, one that to a life-saving one.
Yeah.
Nothing more than that.
Yeah,
Just for life-saving.
totally. For
Right.
life-saving
So,
purposes.
are you
going to treat him?
I need to take a look at a couple more things. So,
Okay.
So one thing that we'd like him to do is to pass all the range of motion tests. So we're just going to check a few of these upper body ones, and then maybe we'll treat 1 or 2 of them and see what happens, see if the pain improves.
That's great. So did you guys have any other questions on
Oh, yeah,
those?
go
The
ahead.
upper body perpetuating factors? That makes sense? Something you guys could pretty easily do? All right. Good.
So we're going to check cervical range of motion. So here we're going to go. So here ear to the shoulder. Oh, we're a little bit tense there. Ear to the
Okay.
shoulder.
Anybody remember what it's supposed to be able to do? Ear to the shoulder means it's supposed to reach the shoulder.
That's right.
He's confused. He's thinking.
No, you don't lift the shoulder up.
Okay, so chin to the chest. Here.
Into the chest.
Okay, here. Oh, he can do that pretty good.
Yep, good.
That's a pass.
You know, all the computer. We're all good at cranking our head forward.
Yeah.
It's everything else we can't
Okay, so
do.
here we're gonna go turn and rotate over. Look over this way. So here we want to get it to about here. So we're missing about 2 inches there. Let's go the other side. And we get it to about here. So we're missing a little bit in the rotation. So minus 2 inches. Okay, so and let's look your nose up to the ceiling. Okay, so here you should be able to get the nose up a little bit more.
Yeah, he's not extending as well, and you can see it's tense. Don't forget, guys, when you're looking at range of motion, is it the degree that matters? No, it's not only the degree, it's the quality of that motion. If somebody is glitchy and wincing when they're getting to full range of motion, that's not a pass.
Yeah. So I'm checking the scalene finger flexion test now,
Yep.
and he passes all those. But when
Yep.
I'm doing that, I'm feeling his hand that it felt a little cold. So I'm going to do the rights maneuver. So I'm just
Okay.
going to feel his pulse here for a second.
Another way to check if the scalenes are compressing.
And the pecs is particularly.
Oh
okay,
yeah,
with
oh
your-
sorry, pecs, right?
So I'm going to just go ahead and take it back this way. Yeah, here it cuts off the blood supply.
Okay.
So it's just I can
Is
feel
that pec minor then?
Pec minor,
Okay,
yeah.
it's pec minor.
So yeah,
okay.
I could feel that your hand was a little cold.
Yeah.
So here, we'll do it on this side. So we're gonna check the radial pulse. So you're gonna feel it on the thumb side.
Mhm.
So you can feel it. He's got a good pulse on the right side. Now I'll check the left. Yeah, good pulse. Now I'm gonna check to see if this muscle here is causing you to have compression on your blood supply there. So okay, here. Yeah. So both sides. So this muscle will know it's better. So you could check it yourself. So go ahead and you check your pulse right here. Yeah, on that side. You could, but these fingers usually feel it
Yeah,
easier.
flip it around a little easier so you're.
Yeah, those
yeah.
fingers, yeah. Can you feel your pulse? Oh. Okay, good. Yeah, I felt it there. Yeah, but now take it up to here. Yeah. So you know that the pecs are good. If you can still feel the pulse when you come way up like that. Yeah.
I can feel it.
He's feeling it good. Well, I can
He
sort
need,
of
well, he
reduce
would
that.
need to extend his arm further back out.
Yeah.
Yeah.
Oh no, the pulse is gone.
Yeah,
it's gone,
that's
right?
it. That's it.
And it
Yeah,
gets still
yeah.
out
So that's
there.
that's the pec mine.
Yeah.
So that's the same muscle that's doing this, making your head.
And don't forget palpation. Why don't you palpate the pec minor just
Yeah.
to give them a
That's
clue?
it.
But
Like, that's it right there. Yeah.
what should a
It's
muscle
little-
feel like when you
it's a
push
little
on
tight. It should be.
Yeah,
a little,
it
Yeah. See, what
So
should
they're
a
gonna-
muscle
you should
feel like
it.
when you
Feel this
push
one
on
over
it?
here. Should feel soft and flexible.
And
So
no
go ahead.
pain.
No, it
Soft,
shouldn't hurt.
flexible with no pain.
Yeah, there. So there.
But not flaccid. It should have tone.
It should have
Yeah.
some tone.
It should be even, consistent tone.
Mm-hmm.
That's soft, flexible, and pain-free to touch. Right?
So this pass.
It hurts.
Mm-hmm.
Was there anything else on that evaluation sheet that I missed here? Give me the top page. Let's see.
Okay, so
No, so we did posture. The first half is devoted to posture.
let's do the mouth wrap test. So this here. So come like this. Can you get your
So
hand
we did
around
all
like
that.
this?
Yeah. Good.
Good pass. Try the other side.
Okay.
Okay. Oh, that's a pass. It's a pass. Great.
Okay, he just passed. Can you show me those again? Which one is that?
That's the mouth wrap test. So you can like this.
And
you
what
see-
muscle is that for again?
That's the infraspinatus. So this is what it's so here. So the mouth wrap. So here. So if you take a look here. So we just did the mouth wrap test. He passed. So I'm going to put pass. But if he didn't, then it could be any of those muscles could be causing it to be dysfunctional. But the one on the top is the most likely.
Yeah.
So that'd be infraspinatus. Next we're
These
going to do
guys,
the
you can
hand to the
download these already. I have these uploaded already.
So the next we're gonna do a hand to the shoulder blade, and we'll see that's also the infraspinatus. So can you do this, Tony? So can you come like this? Can you come like that?
Not too bad.
Yeah, it's good. That's good. So it's perfect when you get up to here, but this is perfect. Still good. So the
Not
other
bad.
side,
Better than mine.
good. So this is a pass. Pass. Okay. So let's do the arm pull back. So let's take it up here, and we're gonna take it back there. Oh, that's in the standing position is very tight.
Yeah.
Okay, and we'll pull it back.
So,
Okay.
who's guessing pecs? Who's voting for pecs?
That's a peck.
We're gonna treat pecs. Yeah.
Peck. So you can pecs.
Oh, I'm just gonna go look at the range of. I'm gonna look at the pain pattern for the pecs.
Okay. Okay, so let's have you lay on your side, and then we're gonna
Pec
treat one or
major.
two muscles and see how they do.
Minor.
Body support system.
So,
So have you lay sideways.
gosh, good.
Oh no, we'll just use yeah. Have you lay on your side.
There's the anterior scalenes. Yeah. Okay. You didn't have
Face
those.
the
in it.
window for a
And we wanted to check serratus anterior, right? Because he
minute. I'm
had
gonna
that.
do that. Yes.
So guys, you see how serratus anterior causes pain right there. So we wanna look for.
So we're gonna see if we can. So also we're gonna do this rotation test. So here we're gonna, and you see, your shoulder is supposed to come down to the table. So it doesn't want to come down. So you could measure a few inches there.
Yeah.
Yeah. Okay. Let's try the other side. Here. Okay. So the reason that it's not. Let me show you the test. Okay, so this part stays still. Okay, this doesn't move. So with this staying still, can the shoulder? Yeah, but this has to stay. Okay, so here, see there. So now we measure the shoulder from the shoulder to the table.
Okay.
Okay,
And
so
that was for anterior serratus and.
and also the chest, the
Oh, yeah,
abdominals,
chest and
the
yeah,
chest,
yeah.
the pecs. Yeah, this is just the anterior serratus. Okay, so this side here. So here you want to be able to get it to come down maybe just a little itsy bitty better than that. Yeah.
So it's not too bad.
Yeah. No, not too bad. Yeah.
Yeah, so-
Not too bad. So let's look and palpate some of the muscles and see what happens.
So what is our
So
what is
stand
our
up
best
one more
guess?
time.
What is our best guess on this so
So you
far?
stand up one more time.
What's causing this upper thoracic pain?
Well, I think it's the levator scapula, which is the second most likely.
Okay.
So we'll take a look at that. I think that also the scalenes probably have a little bit of dysfunction. Let's check it.
And I think the multifidi for sure, because those
And we-
super
and the
sensitive spinal segments.
Yeah.
Yeah.
Let's have you lay sideways and face towards Justin. And put your shoulder right here. So this is how I usually set up the table. Okay, so we'll do a little bit of. Okay, so let's take a look at the scalene. So let's look for some taut bands in the scalene. So what do you think of this area here, Tony? Is that painful?
A little.
A little bit, okay. So where's the pain right now? Where do you notice the pain right this second? Right there. Okay, right about there. Right
Yep.
about here. Right about just the
A
scalene.
little to the right.
Mm-hmm. A little bit more to the more like right here.
Yeah.
Right here.
Yeah.
Right there. Okay. So let's take a look at the anterior serratus and the scalenes. I think the anterior serratus. I'm feeling the scalenes. Okay, right here. So here, so what I'm doing right now, Tony, is I'm finding a taut band of muscle. I'm pressing on it, and I'm pushing the painful chemicals in it out. So, tell me if it's a little bit painful here. Is it a little bit painful right here, or just feel
No,
hard?
I only feel it, the place you put your elbow.
Yeah, just where I'm pressing. That's what I meant. So it's
Yeah.
hurt a little bit right where I put my elbow.
Yeah, it was before.
Yeah.
Not now.
The other spot. Yeah.
Yeah.
So what we want to do is get this. So what you want to just have him in this position here, and you want to get this elbow down. You see how it stops right there? So we want to get this elbow down. So that'd be the pec and the anterior serratus. So we're going to go ahead and treat that a little bit. So here, let's see if we can improve that.
Sharon, would we ever palpate where he's experiencing his tenderness in the thoracic spine and then correct the perpetuating factors and palpate again, see if the tenderness instantly decreases?
Yes, we might do that.
Yeah. So
Yeah, well, I think we should be treating the spinal segments.
we definitely, I mean, it's more and more as I'm looking at this
Yeah,
list
oh,
of
yeah.
muscles here,
Yeah.
guys. It's he's passing quite a few tests, so the pec minor is definitely a big problem, but that doesn't necessarily refer pain to that area.
Okay, so
The
that's
ones
better
that
right
do
there.
refer pain to that area, I think the multifidi are.
What if we
you
what if we treated the supersensitive spinal segments and then
Yes.
saw if some of the other things improved? That'd be interesting. Yeah.
Yeah.
Should we do that?
Yeah.
Okay. So I'm just gonna feel the pec minor here. So I'm gonna feel it while I'm moving it. Okay. Okay. So we're gonna keep treating it till we get good pulse into that hand.
Okay, so she was feeling the pulse, bringing it up into Wright's maneuver to
Yeah.
feel it go away.
Okay.
And
So
then
now
she treated it until
I'm gonna
it-
treat
it-
the supersensitive spinal
fixed it.
segments.
Okay.
So I'm gonna have you just go like this and just lay all the way, it's kind of like this. Leave your shoulder right here. You're gonna lay kind of like this, and you're gonna keep, put your head just like that. Yeah, that'd be great. And then this arm this way, super. So I'm gonna come right along. Remember, he was really tight at all from 3 all the way down to here. So I'm stretching him a little bit while I'm pressing on it. And so you tell me, how's that feel, Tony? On a scale of 1 to 10?
Nice.
Kind of nice.
Nice. I don't know if that's a number,
That's a nice-
Tony.
That's a great number.
That's
Nice is the best number.
Okay, so here,
1,
feel
2,
that,
3,
Tony.
nice, 5, 6.
Right there.
2.
2, okay. So here we're going to go a little deeper. So I'm going to stretch it a little bit while I'm pressing out. So here's the spine. I'm coming just to the side of it. I'm pressing in like that. What do you think of that pressure?
5, 6, 9.
Okay, good. So finding the spine, come just to the side of it. And I'm going to press in. So this is correcting the supersensitive spinal segment.
So what is it, guys, again? Our 3-part evaluation, but it's really a 4-part, isn't it? So, yeah, it's the pain pattern, range of motion test, palpation, which is the gold standard. You don't need anything other than palpation to be good at trigger point therapy, but the others are very useful as well. And then the perpetuating factors. Now treatment, which is what we're getting into now, it's a 3-part treatment now, isn't it? It is part 1, heat, part 2, compression, and part 3, range of motion. So it's a 3-part treatment, and in fact, every time I say 3, they like to say 4. But if you divide stretching and range of motion separately, then it's 4.
Well,
but
this is movement. This is
yeah,
movement.
yeah.
This is
but here it is. Self-care, we have them warm up, then we have them do compression,
Reach the
and we have
same
them
way the
stretch,
other way, same
and then
thing.
range
Use
of
the arm
motion.
underneath. So on your tummy again.
So it's a 3/4 part assessment and 3/4 part treatment.
And this shoulder pain. Okay, and you can have your head right there. That's fine. Okay, So we're going to come along, find the spine, come just to the lateral to it, and we're going to go ahead and press right in there. So we're going to go ahead, we've got it stretching a little bit here. So find the spine, come just lateral to it.
Now some of you might say, and I could hear a voice in my head say, well, I would have worked on this spot anyway. Why go through all the fancy evaluation?
Oh.
Right, but the thing of it is that we found so many other things. For example, he didn't know that his pulse disappeared when he, because of his pec minor. He also didn't know that he was definitely going to develop problems because of that foot deformity. There's just no way to avoid it. Eventually you're going to have some knee, hip, low back, shoulder, neck, even jaw issues that come from the feet being, having that first metatarsal deficit.
Can I have you lay on your back?
He also...
The pillows off of it.
Okay.
He also realized he needs to practice his breathing.
That's it.
So that
that's
was
it.
a huge benefit for him.
That's it. Uh-huh.
So the things that you're correcting in this person's life, because you did a fuller evaluation, is that you've taken you've taken this little mid-thoracic pain and you've turned it into a window of opportunity to change his whole life. His whole life is going to change, and all he came in thinking was that he was going to work on his thoracic spine. That's all he thought. He didn't know that he was going to get something that started at his toe, big toe, and fixed problems all the way up his entire body. He didn't realize that he was going to be more conscious of his breathing, which has lots of benefits physically, but also mentally, emotionally, spiritually. He didn't realize one of the main benefits of getting treatment is realizing that pain is not something to shy away from, that it's something to work through and find the benefit that comes from going through to the other side of it. What lies beyond pain is function. And so he's learning that.
So I'm going to train you to treat a little bit of those muscles yourself. So go ahead and bend your knees here.
And now he's learning to become self-reliant.
So here you're going to go ahead and kick underneath here and find right along the spine. And get one hand here and one hand here. And you're going to feel right up there. Yeah, and you're going to press the tool like that into it. You're looking for the little tight spots there. So little painful tight spots.
Yeah.
Come right along there like that. So that would be one way to start to work on those, yeah. So we're getting close to the end of our class today.
Yes, we are.
Yeah. So next week we're going to do perpetuating factors for the lower body,
Great.
and then the following week we're going to do perpetuating factors just the Morton's foot. So we're going to just really go into Morton's foot.
You're going to be so good at it.
And then we're going to show you how to cut the shoe inserts and
Yes.
how to do everything with Morton's foot.
Yep. You'll be perfect experts at it.
Yes. Okay, so this is how you can treat yourself. So often you could just take this with you everywhere, and it's a good conversation starter.
Yeah, what's this called?
This is called a back knobber, but it does a really good job of getting in between the shoulder blades.
Yeah, I like it. It's really good.
Right? Very good job. So you can get in there with
Better
all
than
those.
a massage.
You do any time of the day. Take it with you, and if you have it with you, then everybody else wants to use it. Everybody else likes it too. So you can treat your trapezius, your rhomboids. You can treat all the muscles.
Yeah.
And so also, remember what about the one on the side of your chest? Let's have you sit up for that one.
Okay, guys, if you want to review this class again, for the next 24 hours, you can go to periscope.tv/yournsa.
So hang on to it here.
Okay. You love tonight? Thank you, guys. Excellent. People are enjoying this class.
So
Okay.
here, come right there.
Or you can go to our
Right
YouTube
there.
channel, and within sometime this week,
So this is
I will
spots right there. Go really big, really right.
our
into
YouTube
this
channel.
area right here. And then
Just
how about the pick? Remember the
go
pick?
to YouTube.
So here we go right here by the collar. Press in, okay, and just press right there on your pick. Yeah. So you press as much as you. So the sensitivity is painful chemicals that get stuck in the muscle. What you're doing with your press in is you're pressing those painful chemicals out. So one thing you could just press there. And remember, I was trying to get you to do this at the same time, so you could do that. So you can press in it,
Yeah, you just go to youtube.com, yeah.
or just press.
So guys, go to YouTube.
do this seated too, like this, to the top of your
That's
shoulder
the
right here. So this is one of your muscles. It's bothering you right here. There. So you can get right after that. So I'll
seems
send you
working.
home with protocol.
Well, you go to YouTube, guys, and you click on and you search for
One of the protocols and shows you how to
your
press.
look for National
You know what it
Self Care
is?
Alliance.
Am I on YouTube?
Yes, it is.
We're having something goofy going on with our computer here.
Okay, so here's the muscles that we're treating. So this is the one you're just treating right now. So this one, see how it starts here and it goes to your shoulder blade. So here, so you're gonna get right on it. You get it. So you feel the shoulder. So you see that's the shoulder blade right there, and you're gonna press right on it. That's one of the muscles that
Welcome.
causes the pain there.
So go
Okay,
to
so
YouTube like
this is
this.
between the shoulder blades,
Search for
which you're just doing laying down,
National
and then,
Self Care Alliance.
and then also these other muscles could cause it as well. So the ones between the shoulder blades, the ones inside the neck, and also this one. But also we want to do right along the spine in your case too.
I don't know what's going on with the internet here, guys, but if you search for National Self Care Alliance, then our channel will pop up.
So here-
Assuming,
So we want to come right along the spine.
assuming it works. Well, anyway, your computer will work. I don't know what's going on with ours tonight, but okay. And then you can always get these handouts, of course. So you've got everything you need to start doing this work.
Yeah, so this is protocol number 12, so that with pain between the shoulder blades right here where he has it. And so we're reviewing some of the muscles that cause that pain.
Great. All right. Well, we need to sign off, and sure. Do you want to teach him some range of motion exercises?
Yeah.
Helps a lot. Better than taking movements to
Welcome, guys.
Sharon and Justin from Pain Free. Who want
All right, come on, Tony. Everybody has to go through this embarrassment.
Shoulders up.
There you go. On cameras. Good.
And down. And forward. And back. Here's your shoulder. Middle.
Good.
Out.
That's
Rotate.
a dance. That's a dance.
This is it. And go like this.
So see you back again next week.
All right. Thank you, guys. To the person who's asking if they need to stay on this channel, if you're using the app, you're using the application Periscope, then you should be following us, and then whenever we go live, it'll let you know. And for 24 hours, you'll be able to replay this broadcast. But the best thing is a week from now, within this next week, we'll get it up on Periscope. I try and do it the same night, but it doesn't always happen. And then when it's up on Periscope or up on YouTube, sorry, you can replay it forever. And I think the quality is a little bit better. It's a little bit easier. Okay, wait,
The pain is gone.
Sharon.
The pain is
I
gone.
just noticed I don't feel like painful anymore on my back.
Yeah, see, the pain is gone. Now, will it come back if we don't address the perpetuating factors? Most likely. Maybe not, but... oh, I couldn't hear my answer? Okay, so...
We're going to give you some shoe inserts.
Oh,
Your shoe.
periscope.tv/yournsca.
Could you put some shoe inserts?
That's the channel. You can come back to that anytime on any computer. If you're using the phone app,
Okay, so
yeah,
you can
this, I understand. You're saying it's trying to reconnect. I know. Sometimes I have issues with the replay. But,
this one here.
so I'm going to upload it onto YouTube right now.
We went right along the spine.
Do you want to go to the YouTube channel and you can catch up on all the,
And
let's see.
this one here on the side of your chest. Okay, that
Pecs.
works. And X.
Okay, let's turn this around, guys.
So we'll draw that one in. So it'd be good to do the top of your shoulder here. Good to come down here.
Okay, this is the
So
channel.
This is the ones we did along the spine. So here we these
National
tiny
Self Care
ones right
Alliance.
here.
And there are all the videos from the very beginning.
Mhm.
Okay, all the videos we've done. I'll upload this one.
So those we should do
and it's going to be sideways for a little bit because it takes time to get it to be straight up and down. But I'll upload it right now, and then so within the next 20 minutes or so, it should be ready to go. You can watch it on this YouTube channel. Okay. Otherwise, you can try the Periscope replay, but I've had some problems. If you guys are having problems, I've had some problems with the replays as well. So let's see. All right, guys. Thank you very much. Love you. Have a great night.